hard to believe that the 21-22 school year is just about to come to an end, but it will before long. So all of you that are on, we'd ask that you mute your mics for now. And then I'm going to ask Kayla here in a minute to go ahead and call roll. And when she calls roll, if you can just unmute and say here or present, and then we'll move on to the rest of the agenda. So again, welcome to the meeting. And we'll go ahead and get started. So Kayla, if you could go ahead and give us roll call this morning.
Good morning, everybody. Kathy Bush.
Present.
Jean Clifford. Dr. Jane Groff.
Here.
Samantha Brown. Shelby Bruckerhoff. Tracy Chauvin.
Here.
Jose Cornelio.
Present.
Misty Shervonsky.
Zarnowski here.
Okay. Sherry Domelin.
Good morning.
Diane Gierstead.
Present.
Lori Hattrip.
Cherie Blanchett here on behalf of Laura Hattrip.
John Heim.
Kayla, John's not on. Brian Jordan from KASB
Okay.
is the new executive director, so he would be the person in that position now.
All right. Well, Brian Jordan, are you on today? Okay. Gary Hinault. Leah Hawley or Leslie.
Leah's here.
Tamara Huff.
Good morning, I'm here.
Dr. Ken Huey. Kimber Kotzitz. Mallory Keefe. Kathy Ko.
I'm here.
Monica Kurz. Ronnie Lawrence. Lori Marshall.
This is Sue Marnan. I'm with the Association of Community Mental Health Centers. Lori's no longer with the association, so I'll be taking over her spot on this committee.
Welcome, Sue, and would you put your name and contact information in the chat box so Kayla has that for future reference?
Yes, I will.
Thank you.
Melly Martin. Dr. John McKinney.
Present.
Kathy Mosier. Monica Mernan. Dana Novak. Kimberly O'Connor. Judy Rodman.
Here.
Melanie Scott.
Here.
Shirley Scott.
Present.
Adelia Schumann. Rochelle Sodman.
Soden, I'm here.
Soden. Dinah Sykes. Mark Tokelson.
Yes, ma'am, I'm here.
Kelsey Torres.
Here.
Ryan Vaugh. Julia Walker or Paige White.
Is Casey Dalkey. Julianne Walker is no longer with the agency, so I am the new executive director of Children's Advocacy Centers of Kansas. I will be taking her place at these meetings.
Casey, if you welcome, first of all, and if you'd go ahead and put your information in the chat. So Kayla has that information, and also the position that you're filling in for would be helpful. Thank you.
Pam Wigand. Holly Yeager.
Here.
Janie Humphreys.
Present.
And Jamie Dover.
I'm present.
Okay, and for KSDE staff, Bert Moore.
Present.
Barb Depew. Kent Reed.
Here.
Carrie Haig. John Calvert.
I'm here. Good morning, everybody.
Carrie's here too, Kayla.
Okay. And Shanna's here.
Yep.
And then Alicia. All right. That is everybody on my list. Did I miss anybody for today's meeting?
This is Ken Huey. I got on a little late because I had computer issues, but I'm here.
Welcome, Ken.
Thanks.
Thank you.
Okay, well, thanks, everybody. Just kind of a note, if you look at the bottom of your agenda, the next meeting we have at the end of July, which is, of course, right before the next school year starts. And we are going to have that in person. So hooray. We'll be back face to face. Usually that, and I don't know, maybe Shanna or maybe Bert, maybe you, usually there's a meeting in Wichita. And so we become a part of that. Do either one of you real quick want to explain kind of what that is? And because our meeting is there and we will be face to face.
Sure, I can do that. School mental health will meet on July 26th. Want to let you all know that as a member of this council, we can invite you all to attend. So if there's any cost established with that, we'll work with Kayla on the travel arrangement and reimbursement schedule. And I'm sure she'll be sending that out to everybody after the meeting to make you aware of it. So you can attend the entire conference. It will be a Tuesday, Wednesday, Thursday. So the mental health will meet half day on the 26th, and then the actual leadership conference will be on Wednesday and Thursday, the 27th and the 28th. So we want y'all to be aware of that. And if you need to book your hotel accommodations, I'll have Kayla send that information out to you where you can book that either at the Hyatt or hotels in the surrounding area. And that's something that is reimbursable as well. Normally, KSDE works on you pay for it and then you get reimbursed for it. But we'll work on the registration fee for anyone who wants to attend the conference. If you'll just send us your name and your information relative to you want to attend the entire conference, then that will be taken care of by the council's account. So want y'all to be aware that we would like for you to attend. We have a draft agenda right now, so we will be sending out the leadership agenda soon. So if you're on the cusp and you're like, well, I don't know what this is, I don't have any idea if that's something I want to attend or not, we'll make sure that you get that agenda as soon as we get it finalized. And then you can make up your mind and you can contact Kayla and let her know that you'd like to attend the conference. Otherwise, we will have availability for you on the 26th so that you can attend the half-day school mental health. And Kayla, I believe that's scheduled in the morning, is it not?
I believe that is correct.
Yeah, and normally then we offer a luncheon, and that luncheon is a combined lunch with the Special Education Advisory Council. So it's an opportunity for the two councils to meet and greet and have an opportunity to have a meal. And then in the afternoon, the school or the Special Education Advisory Council meets in the afternoon. So you would have that afternoon open. We do have a new directors opportunity occurring that day. It will be all day for all new special education directors. And we also will offer a local consolidated plan title program overview that day as well. So you may want to sneak into one of those meetings in the afternoon after lunch if you so choose to. Otherwise, you'd have the afternoon to yourselves and then start the conference the next day if you choose to attend. So Kathy, if anybody has any questions, they can just contact Kayla and we'll make sure that we get information out as soon as it's available. Shanna, did you have anything you wanted to add?
No, I will just tag onto this though, that I've also sent out a council member update. So if you are planning on leaving our council or have another commitment for next school year and have someone that will be replacing you, you can add that into there. I will also just drop the link into the chat so it's convenient for those who are new.
Thanks, Shannon. For those of you that are new, you will fill out the term of that existing person that was in that position because they do have the authority to appoint someone to attend. It does not mean that you would be within a term. We have 2 terms available to our members, but when you fill out a term for someone, that doesn't count as a first term because you're just filling in for that individual, but you would be eligible then for a first term as soon as that position expires. So we have 2 3-year terms for positions, and no one will be leaving us this year due to a term expiring because we put everybody in either a year 1 or a year 2, and we put you as your first year of that term when we started this year. So there are people here that are attending that have 2 more years or that have 5 more. So we're glad you're here, and I'll turn it back to you, Kathy.
Thank you. Thanks for the update, Bert. And Shanna did just send that email, so it should be in your inbox now as far as membership. So those of you who mentioned that you have you're taking over somebody's term, you might particularly pay attention to that email from Shanna. Shanna Bigler is who that came from. Okay, well, thanks for everybody for that. And Bert, thank you so much for the update for this summer. Again, that'll be in person, so that'll be exciting. We'll get to actually see one another, not on a computer screen. So that's on July 26th. It'll be in the morning at the Hyatt here in Wichita. So look for more information soon coming from Kayla. So thanks to everybody for that. Okay, we're going to move on now to the approval of the agenda. And if you would just unmute and say your name and that you are moving to approve or second the agenda, that would be great for our records. So I'd look for a motion to approve the agenda for the April 28th meeting.
Mark Torkelson moved to approve the agenda for April 28th.
Thank you, Mark. Have a second?
Judy Rodman, I second.
Okay, we have a motion by Mark Torkelson and a second by Judy Rodman. And Kayla, I'm kind of guessing we're going to have an electronic opportunity to vote here.
Kathy.
Say again. I'm not seeing anything. Is anybody else?
No, nothing yet, Kathy.
I don't know who all is back on KSDE. We went out on our internet for a moment, so hopefully we can get everyone back on and going again
Okay.
here in a moment.
Okay. Good old technology.
This won't happen when we're together.
We can all raise our hands.
Right.
His video disappeared too, except for me.
Yeah, you're back, Bert. I see Shanna in the box up there. Okay, Kayla's come on now as the host, so hopefully she can get that piece up there.
Kayla mentioned in the chat that she's having technical difficulties.
Okay.
I'll go out and check.
Okay, there it is. It just popped up on
Okay.
mine. So if you see that on yours, which I'm hoping you do, click either yes, and this is for approval of the agenda. Click either yes, I approve, or no, I do not approve. And then hit the submit button.
Yeah. We're getting them back now. Yes.
Okay, we got approval of the agenda. All right, let's try this.
Yes. Yes. We're trying to get there.
Kathy, did we have a motion and a second to approve?
We did.
I didn't know.
Mark Torkelson made the motion and Judy Rodman did the second.
Okay.
You get that?
Yes, thank you very much.
Okay, you bet. Like to say, technology, we love it when it works, and when it doesn't, not so much. Okay, let's move on to approval of the minutes, and this is for the March 2nd meeting. And we'll take a motion and a second for this. And again, same procedure as before, hopefully without the computer outage that we just had.
Misty Zarnowski, and I move that we approve the minutes from March 2nd.
Thank you, Misty. Have a second?
This is Rochelle Soden, and I second that we approve.
Okay, we've got a motion by Misty Zarnowski and a second by Rochelle Soden for approval of the March 2nd minutes. And again, hopefully that script, there it is. Very good. Either yes, I approve, or no, I do not approve, and then hit the submit button, please. Okay, and we have approval of the minutes for the March 2nd meeting. Thank you, everybody. Thanks for holding with us while we work through those little technical issues. Okay, Kayla, do we have any public comments today?
I have not received any.
Okay, well, at this time, in lieu of the public comments, we're going to have kind of a special presentation. So is Teresa Palmer? Teresa, are you on?
I am.
If you'd unmute and show us your face on the,
I'm here.
Turn it over to you. And if you'd introduce yourself and tell us your position so everybody can get an opportunity to see you, and I'll turn it over to you.
Thank you. Good morning. Like Kathy said, I am Teresa Palmer. I'm the Vice President for KSDE. If you're not familiar with KSDE, KSDE is the state association for school social workers. And I just wanted to say, like, the last 3 years, KSDE has been given out an award called the Champion for Children Award. Recently, we were accepting nominations for this year. And what that award is, the Champion for Children Award, it recognizes a non-school social worker who supports the social work profession, as well as they demonstrate dedication promoting school social work services in the school. So I wanted to use this platform to introduce the recipient of the 2022 Champion for Children Award. And that recipient is none other than Shannon Bigler. So unmute yourselves and give her a clap.
Woohoo!
Yay, Shanna!
Okay, well, as a member of KSWA, I'm taken really by surprise. I had no idea this was happening. So Tracy, we're super sneaky, but here's what I just got brought by like a whole bunch of people in the office. And thank you all so much. That's very exciting.
So they did a pretty good job of keeping a secret there, Shannon?
Yeah, they kept a really good job. Here's Dr. Watson and Carrie's in here.
Randy's even there. Excellent.
Yeah.
Yeah.
We have a recognition committee. So her name, it went through the whole process. So it didn't go through the whole board. It's just the recognition committee who made the selection. So congratulations, Shana.
Thank you, guys.
But Teresa, thank you very much for joining us and making this presentation to Shanna. Shanna, congratulations to you for receiving this award. That's outstanding, and have one of our council members and one of our KSDE staff to receive this prestigious award is really a testament to the work that's going on in the department and the work by you, Shanna. So thank you very much. You want to share a little bit about anything at this minute? I'll give you a minute to share something. We'd love to hear from you.
I am just super honored and excited. I joined this team a year and a half ago, and it's the people that are here and the people that are doing the work, especially the social workers in the field and the staff here at the office that really make everything happen, all the partnerships. So I have really enjoyed what's happening and where we're going with mental health in schools for kids. And I think we're just going to keep getting better all the time and every year. And we've got great people to do that. So I really don't know what else to say. I had no idea. So thank you.
Well, thank you for your work, your untiring work, Shanna, and what you're doing for the kids in the state of Kansas and the support that you provide to a whole lot of folks. So thank you very much. And I know you'll keep it up, you and the rest of the team. So thank you very much.
Thank you.
Okay, we're going to move on with the agenda now, and we'll get into the meat of the agenda. We're going to start with legislative updates. I think probably most of you know the legislature is back in session this week, busy working on a number of things. Diane Gerstedt, who is a member of the council, has been kind of following what's going on in the legislature, and she's going to give us an update. If you've got questions, you could certainly put them in the chat. For Diane, we've got enough time for some questions. And actually, she's doing the next part of the agenda also. So we'll turn it over to Diane.
Thank you, Kathy. Kayla, if you would let me share screen, please. And I just want to congratulate Shanna Bigler. So well deserved. She's been a great partner to work with. I've reached out to her a number of times. I've had school liaisons reach out to her, and Shanna's always great to provide information. And I just happy for you and congratulations, Shanna. Okay. Can you see my PowerPoint presentation? Okay, great. So the legislature is still working. They had first adjournment on April 1st. And last year, the budget committees returned, and then the full legislature returned this week on Monday. They are planning on doing something rather unusual, and that's around a couple of issues that they have. So they're not gonna, the plan is to not finalize their work like this week or next week. Their plan is to get the bulk of it done and then come back later in the month and work on additional, if there's any more governor's vetoes. And of course, the main thing hanging out is the congressional map that was overturned by a district court judge. That now that ruling has now gone to the Kansas Supreme Court, who will rule not, as I understand it, on the merits of the map, but rather on the legal premise that the court used. So I'm going to give you my little update. I am no Laura Jurgensen, so Kent Reed will be disappointed, I'm sure, because I'm not an attorney, right? And I just kind of follow things. So just want to give you a couple of things that are going on right now. This week, the Senate came back. The governor had vetoed two bills, one being Parents' Bill of Rights bill, and the other one being a bill that dealt with trans girls not being allowed to play high school sports. And those were both overridden on the Senate side. They have to also be overridden on the House side, and the House has not taken those up this week. The word on the street is that the House is going to wait and take those up later. I just wanted to spend a moment talking about money, because most of the programs that all of you are working with are funded in some part with state funds, or your partners have state funds. And I just want to have you look at this ending balance line. It is simply incredible what the ending balances are. Those numbers are in billions. And when staff was reviewing this last week, they just used kind of like, never thought they would see these kind of numbers. Of course, the legislature is not done, and this line right here shows you the ending balance. So typically we struggle to have like a 2 or 3% ending balance, and if nothing else would happen, the ending balance would be like 34%. But of course, that's not going to be what happens. Yesterday in committee, they agreed upon a reduction of the sales tax on groceries to be phased in over about a year and a half. And that's almost $500 million. And there are other tax bills that have not run yet. And so I'm looking at all my sticky notes that I have, but
Diane?
Yeah.
Was the food tax was just approved by the Senate, not the House, correct?
Yeah, it has not worked its way through the whole system, correct? Yeah. So, and that's not reflected in this chart. So outstanding, there are about $1.4 billion of additional bills out there in play. If all of them pass, which all of them won't pass, but if all of them pass, we'd have an ending balance of about 1.7 billion. So, I mean, it's really wonderful. We have a healthy state profile for a change. A few things that were in the mega bill that funds everything basically but K-12 schools. The governor has signed that, so it's in law. She had 2 vetoes. One dealt with legislators being able to sign up late for papers, and the other was a grant to Benedictine College for about $100,000 or $200,000. And her veto message said that they're not a state university, so they shouldn't be receiving those dollars. They paid off a lot of debt on water, some reservoirs, papers, bonds. So they paid off debt, which really helps going forward, because then you don't have those debt payments, kind of like the mortgage on your house. Once you pay it off, it's like, woo, more money. And much needed pay increase for state employees. A few of the high points in human services, and those of you who work with these agencies are in there know this much better than I do and can give better information, but added some money for workforce recruitment. I think these are also like retention bonuses that can be used across a wide number of organizations working with DCF. And increased rates. Oftentimes our rates, as you all know, are very low, hard to do business with low rates, and almost impossible to do business when you can go down the street and go to work for anybody for $15 an hour. So they increased EMS codes. Medicaid services for adult dental, much needed and delayed increase. Provider rates for pediatric care. Home and community-based services received an increase. Frail and elderly waiver receives an increase. Behavioral health services for Medicaid eligible, an increase. The T waiver, that's a waiver for children who have severe medical needs for like in-home care. And that is kind of getting up to where they wanted to be about 5 years ago. Psychiatric residential hospitals, and then, oops, sorry about that. And then added some money for the DD organizations for assessments. There's a long waiting list for people on the assessments. Put some money into a housing program across the state of Kansas. Affordable housing is certainly an issue. And those of you who work for a CMHC probably should weigh in on this one, but it's my understanding that the funding for the transition to CCBHC came in at a higher level than anticipated. So what I heard in committee yesterday was concern from legislators about whether or not there's been a cap put on this. The department, actually the governor's person said, no, there hasn't been a cap. But again, those of you who are in CMHCs would know better than I. And then the advanced practice registered nurse bill passed, and that puts us on the same footing as the VA hospitals and about 25 other states. So as I think CCBHCs and other organizations are looking for people to help with med management, things like that, that should be a positive for you. There is some concern, of course, about what happens when the federal spout turns off, which it will. So especially like FMAT, the chair of the committee has raised a number of concerns about that, and then the ARPA dollars in general. Now there is another committee called SPARK. Don't ask me what it stands for, but it's a committee that has been working on looking at all of these ARPA dollars, and organizations and institutions have been able to apply to receive some of those federal dollars. My understanding that they have about $400 million to work with right now. And they are looking at kind of broad topics like economic development, workforce, housing, childcare, broadband, community health. I'm not sure about what their timeline is. I think they're going to be coming out with some decisions this week. Others of you probably have that information and working with them. Now, I worked in education, so I spent a lot of time kind of still listening to the education conference committees. The conference committee finished up last night about 4:30. The Democrats are not going to sign the report. The conference committee is when you have 3 people from the House and 3 people from the Senate, and they get together and they negotiate. And then when that negotiation goes, when they agree on something and they sign the report, then it goes to the House votes, it goes to the Senate votes, but there's no additional time for amendments by the other House members. It's just those 3 that control it. So the governor had recommended full funding of Gannon. The legislature has agreed with that. And with the exception of special education, it was not part of the Gannon decision. So special education has been in play. Governor recommended adding $30 million to it, and the legislature has disagreed with that. And from the sounds of it, I think they're going to spend some time next year looking at the entire sped ed formula and how those dollars are distributed. So there were some increases. John Calvert received his Safe and Secure School grant, and that's been changed a little bit because they added language to allow schools to apply for a new SRO position and the grant could cover up to 50% of the salary, and I think that's only for 1 year. So John will be working with that, and also he and I will be working with the next item, which is the school mental health partnership, and the governor recommended and the legislature agreed to add an additional $3 million. So the current districts will be renewed if they apply, if they want to be renewed. And then the $3 million, according to the legislature, the priority will be to brand new districts. There's been a lot of talk the last few years about a dyslexia coordinator. And I think the legislature wanted the department to fund it, self-fund it. And they this year have approved funding that position. And then they have about 19 different policies that are in this funding bill. So it's a mega funding and policy bill. And it has many different parts, one of which is a 3rd grade reading target goal. And they're calling it Every Student Can Read Act. And there'll be some reporting districts will need to talk about and share what they're doing for interventions and how they're achieving this goal. A lot of talk around a virtual math program, and now I believe the Department of Education will be selecting vendors who can fulfill that, and it'll be for districts who have, I think, 50% of their students perform on the 2 lowest tiers on the math assessment, so tier 1 and tier 2.
Diane,
Yeah.
go back to that, please. Under the one that additional funding for the partnership, you said that will be new districts.
So the language, and John can correct me, but the language as I understand it is the continuation of the current districts, and then the new money, roughly $3 million, the first priority is given to districts who have not participated, so brand new districts. And then if there are remaining funds, then the department and the State Board of Education will look at allocating to existing. Don,
Okay.
is that how you understand it?
So
Yeah.
the folks that are out there that know of other districts who have been interested in this, who should they contact? I know it hasn't officially, looks like to me this is passed. So
Kathy, it's John Calvert. They can definitely contact me. We are working on applications right now, and those are pretty much done. But as everybody knows, we're just kind of waiting for the wink, wink, nudge, nudge, pen to paper. So probably late June, we will be sending that out to every superintendent. We will send it out to every administrator. I will get with anybody and everybody. To add on to what Diane was saying, there's going to be those extra funds for the new districts. Part of that money as well will be going to a third-party study, which I personally am so excited about. And they're going to come out and look at our program and just see some of the great things that are going on, and be able to, as a third party, tell us the areas that we can be improving and the areas that we're doing amazing things. And so really excited about that, but that will also be coming out of that extra money as well.
okay, and I think that should be particularly interesting to the members on this council, that will be able to be expanded. And like I say, if you know some folks, you might want to get that information out to folks. And Shanna just sent an email, so to have some information. So, okay, go ahead, Diane. Thank you.
Always nice to have money to spend on great programs. The bill also will contain some language that codifies that CASA employees are mandatory reporters. And it adds additional language about building needs assessments that local boards of education will need to look at each building and proficiency levels on the state assessment and make a determination of the barriers for students to achieve level 2. So they want to get all students to achieve level 2 and what it requires, the resources, the people and the programs and the budgeting required to meet that goal, and then the time estimated for that goal. I think that's going to be a annual requirement of schools. fits into our work because we all know students that must be emotionally ready to learn or they're not going to be learning. So I think it really fits into all the work that we do too. Open enrollment has been rather controversial, but that's in there. And this next portion, I have, this morning I was trying to figure out exactly what's in there, but I do believe this language is still in that would require non-academic surveys to be probably posted and require parents be notified and give written consent, and that's renewed every 4 months in advance of administration of a social emotional survey. Again, things like this aren't written down right now where I can find it, but I was reviewing the conference committee work on March 31st and April 1st, and at least verbally they talked about agreeing on this language. So I believe it's going to be in there in some form. Now, what I know was added back, and it was added back yesterday about 4:30, was language from the House bill that deals with crises. And it talks about that if they believe lines 39 and 40 and 41, if we believe a student is at risk, then the person who's designated to administer a suicide risk assessment or tool may administer the tool. And then it goes to talk about who can do it. And then it says that they must first attempt to notify the guardian or parent and obtain consent to do so. And then it allows that if we have not been able to notify the parent or guardian, the school is allowed to give the risk assessment screening tool and then notify the parent or guardian as soon as possible after that. So that language definitely is in the conference committee report on education that will be voted on probably today at some point.
So Diane, this was the one that folks from this group really advocated for, if I'm remembering correctly.
Right. Advocated for it and wanted to make sure that there was language that would allow a crisis screening if we're not able to get a hold of the parent, which is kind of what I think lines 8 and 9 and 10 are saying, that specifically if designated school personnel is unable to verbally notify the parent after reasonable attempts, you may administer the risk assessment or screening tool without consent. And then, of course, it's really what you do anyway, right? You try to get a hold of the parent, you can't get a hold of the parent, you do the tool, and then you try to get a hold of the parent afterwards as soon as possible. So hopefully this is language that will work with practice.
Okay, but I'm going to ask you to go back one slide.
Like this one?
Nope, go one more, sorry. I wanted to go back because I want to have a question. One more.
Well, this is the only like.
Okay, well, the SEL questionnaire language. So this particular one, and I know you haven't been able to dig into the weeds and find this, but non-academic surveys and questionnaires, and this is the 4-month permission. Would this include, because I'm assuming it would this include when districts do behavioral screeners? I'm not sure what all the tools are folks are using now, but this would fall into this category.
Yes, it would. It would include universal screeners that we're using, Sabers, all of those would be included under that. And also, and I think that this language, frankly, rose from concern about Kansas Communities That Care survey. That's the survey that the chair had. The committee, she passed it around and said, let's take 10 minutes and take the survey. So yes, all of those, Kathy.
So if folks are still concerned about limits on abilities to do some of these screeners, not the CTC and not, I know Mark Thompson's group, they have a big assessment that's done each year. So not that, but the ones that you guys use, if you still have concerns about that, you know, you certainly have the opportunity to talk to your representatives and explain what you're doing with those screeners. And the fact that it gives you timely information and timely support for not only the student, but the family and the school. So just
So looking at that, where it says parents notified in writing every 4 months in advance of administration, is that a change from when it said parents needed to give consent and we would need individual consent for each one? Is that a change, or is that just me being semantics in the wording here?
well, I see the word written consent there also. So
I know, so that's
really-
why I was wondering, do we need a separate written consent for each one like it originally said, or now is it still we can do one consent at the beginning and just give written notification each time we're doing our Sabre screener, our Panorama screener, the KCTC is coming out?
That's a great question, and that's where I don't have the language that they actually adopted. I mean, I listened to it, I heard what they were talking about. So here's the timing on this. They're going to sign and agree to disagree at about 9 a.m. And then when that gets done, they'll sign the conference committee report. At some point today, that report will get read into the House. That report then will contain all the language that's in this bill. So that's where, as soon as that gets posted and I see it, I can pull it up. I'm happy to share the link with Kathy, and she can share it with all of you, and we can go in and look and see what that language looks like. Then when the conference committee report is read in, at some point, they're going to vote on the bill. It's a House bill, so the Senate acts first, and then the House will act. Today's Thursday. I think they want to get out of here on definitely tomorrow, Saturday, but maybe tomorrow. So we might have a little time, but I'll dig in and we'll find that language, and I'm sure people at the department will too, so that we can answer that question.
I'm concerned, yeah, about the written consent part specifically, versus, or the clarification on that too. So I'm with you because, we do at enrollment, parents can mark whether they allow for like the Kansas Communities that Care survey. And I know as a parent, I mark yes. It's also just personally a little bit frustrating, that it's an opt-in instead of an opt-out scenario, it sounds like. But written consent, that's what I'm a little more, that wording means to me, like handwritten consent, not just marking it, but maybe there'll be some clarification there. Yeah, lots of questions.
And I have no doubt once this, whatever is passed, there will be guidance given by the department to the districts, and then the districts will have policies that they will put in place and how that consent. I mean, the way it's done now is generally folks at enrollment do an overall blanket consent, and it's for CTC and it's for other things, quite frankly. So I would, I don't know exactly how this will transpire, and Diane can get information out to you. But right now, what it looks like is at least every 4 months, you'd have to get a written consent from a parent. So that would be something you'd have to, we'll have to see what it actually does. And then, as Carrie says, you'll need to follow your district's policies as far as what they establish for that. So, but just so you know, that's still in play, that piece of the puzzle. And when we hear some additional information, Diane can get that to somebody, and then we'll get it out to members of the council. Thanks, Diane.
Bet. So we'll be watching for that this afternoon. Once that conference committee report is read in, then it's printed. You go in and find that section, send it out to everybody, let you know where that section is. And just know there's a lot of other policy in there to look at, especially on the school side. So the issue is still outstanding. This bill that we're talking about needs to pass and be signed by the governor. It is all the funding for schools. The Spark recommendations, which again have more enhancements in available for a wide range of projects across the state. The 988 crisis line goes live. It's my understanding at this point that there's no funding identified, that the bill creates a fund, but there was talk about having a fee on phones, and I think that was blown up in utility committee. So yesterday in appropriations conference committee, they added $10 million, which I personally think is not enough. They added $10 million for the 988 crisis line. And again, those of you who are working in that will have more information. This morning, medical marijuana started making some progress. The sports book bill is still, they're still working on that, trying to get it. Now that Missouri is moving theirs, that's, I think, added impetus for them to get theirs going. And again, the plan, as I understand it, is for them to get their work done, get education funding done all this week, go home, see what the governor vetoes or not, figure out what the court's going to do, Supreme Court's going to do on the congressional map, and then come back later in the month. Thus endeth my report, Kathy.
Thank you, Diane. As we know, during the legislative session, it's always a moving target. So we appreciate you following that and keeping us up to date. I actually looks like you're the next agenda item, which is the foster care report card. So okay, and you've got some more info for us. Okay, Diane, we'll turn it back over to you.
Thanks a lot. I suggested, Kathy, we put this on the agenda, and I was perhaps in future years, Kathy, you might want to have ECF come and do a presentation because it intermixes with so much of the work that we're doing on the Mental Health Advisory Council. So the foster care report card was the legislature, especially on the Senate side, started talking about it a few years ago. Governor Kelly put it in by executive order, and then the legislature codified it and put it into law last year. So there's been 2 of them so far. And they present to the legislature. I'm not sure if they present to the State Board of Ed or not. I'm hoping that they do. So the foster care report card is, again, it's presented by DCF, but it's a partnership with the Department of Education. And the presenter this year talked a lot about the Education Stability Work Group. And that's a work group that meets monthly. Perhaps some of you are on it. And their focus is everything about foster students, to look at the data, to actually review cases, to work on coordination with groups such as PAJAG and Families Together on how we can better serve students in foster. And he actually said this year that the presenter was Scott Hendricks, that the report card kind of like reinvigorated their group, nothing like a little legislative scrutiny, right? And that they're meeting monthly and looking at all of these issues, and have actually modified the report to look at issues impacting kids, more greater scrutiny, if you will. So when we look what the report does, and I had Kayla send out a copy of the report, so it's in your email box last night or this morning, that you'll see what they presented. And it looks at foster students compared to all other students. And not surprisingly, graduation rate is almost 27 points less than all other students. Good news, that's better than it was 2 years ago when it was like 28%, 28 points. And then chronic absenteeism is much higher than all other students. Attendance for foster, they're not at school, absent, and the dropout rate is higher than all students. Kind of the highlight was, he said, we have more, on the positive note, more students who are foster students receiving mental health services in schools. And I think that's a lot of the program that John and I are working on. Then what they do is they're working with schools to make sure that schools receive information in a timely fashion on where the student has been. And so that they have a charge to make sure that the receiving school gets information within 3 days of a foster student coming in their school, and that information will include the last 2 school districts. They're also, and this is the part that they changed, they're capturing more data on the number of moves and the moves that require a change in the school district. The good news is we have fewer students in foster than we did several years ago. So about 6,500 kids across the state that are in foster. And the representative from DCF called out one of the barriers that they're looking at as the task force are expulsions, and how districts treat expulsions, especially students who are moving from one district to another district. The receiving district, sometimes they say, well, you're expelled there, you're expelled here, and it really impacts their ability to place kids. So that is an issue that they are going to continue to work on, and that schools will be asked to participate in kind of problem solving. So now this little graph at the bottom is the assessment level. And the senator from Senator Baumgartner kind of called out the way they have it, because usually, usually we show it the other direction. So 1 on the bottom, 4 on the top. So these are the, for the state assessments in math, language arts, and science, and it's broken into 3 tiers. 4 is the top, those are the highest achieving kids, is in tier 4. Tier 1 are lowest, and then tier 2 are the kids who are probably on track depending on where they're at in that grid. So what this is saying, that in the first column is foster children, second column is all students. So for all students in math, about 34% were in level 1, the lowest level, achievement level. Our foster kids is over 50%. And so that is, therein lies the concern. And we all know how mental health and mental health services help our kids, especially our kids in foster who are in trauma. So all of these component things that you are working on really impact in what's happening to our kids in foster, and this really kind of lays it out in stark black and white. So I thought I would just share with you for a moment what we're doing in the mental health intervention team program. One of our, when this program was created 4 years ago, the legislators who created it wanted to make sure that we were looking at students in foster and making sure that they were receiving services. So Stephanie Thanisfield from St. Francis reached out, and we have had our educational coordinators from the 4 foster grantees, I think they're called, have met with the school liaisons who are participating in this grant twice this year, just to A, know who we all are, but B, to kind of, they walk through the map and what areas each foster grantee serves. And we also talked about communication and how if we on our side, a liaison, we get a foster student that we know that we can contact the case manager who has a huge caseload, but we can also add our educational advocates to the email stream. I've had a number of liaisons have expressed that that's really been helpful, that they've been able to get the information that they needed quicker. We've also trained our school liaisons to know that, and we share with them the foster, this is a local thing. Every school district is identified a foster point of contact person so that our folks know who that is, so they can go and have a conversation with them and ask them to share information when we get a foster student into the school. And then this, which is this educational placement form, this is the information that is supposed to be received by the receiving school district within 3 days. And so that our liaisons know to go look for that and seek out that information so that they are able to then get the group around and talk about how can we best support kids. So again, that's the foster care report card. It's annual. It really points out a lot of things on the mental health side, the trauma that impacts kids, and the systems in place, and whether or not we are coordinating to better serve kids. And I think it's a great opportunity for this group to help be part of that conversation. Thank you, Kathy.
Thanks, Diane. Good update, and actually probably would be a good future agenda item to have somebody from DCF kind of present on this topic. And I know we've got somebody, I don't know if they're on now, but somebody from DCF, so on the council. So that might be interesting to have some conversation with this group. So thank you very much. Okay, we're going to move on to our next agenda item, which is the mental health intervention team, which is going to be John and Diane. So John, I'll turn it over to you.
Yeah, sure. Hey, everybody. I'll give Diane about a 30-second break to sip on some coffee and get ready to talk again before the Diane show starts going. We are super excited. This program Diane mentioned earlier, it's doing some phenomenal things around our state. It's breaking down barriers. For those of you who don't know what this intervention team grant is, it started off as a pilot grant. I think we've successfully phased out the term pilot though from our grant, just because we've been around now for 4 years. I took this over after Verl Peters retired for about the 57th time from KSDE. I took that over mid-pandemic and worked so closely with Diane, who's just an amazing person to work with and is so intelligent, as you guys can see and know. But what this grant does is it funds a liaison position, and this liaison person, since we're in the midst of baseball season, I kind of call them they play center field, or they're the shortstop, and they kind of direct traffic. They take in referrals. They talk to parents. They talk to schools. They talk to our therapists from our community mental health centers. They help fill out the paperwork and kind of, again, they're the liaison through this process. And so what we know as adults and educators is that we've built up a lot of barriers to our kids' safety unintentionally. But when we talk about kids going and getting therapy, some of them have to drive 30 plus minutes one way to get to a therapy appointment. Some of them, their parents have to take off work, right? And so parents aren't going to take off work. Parents don't have the gas money to get them there. When you have to drive 30 plus minutes one way, you're taking a half day off school. And so therapy is not being attended. Kids are falling through the cracks. The group aspect of it is not happening. And so what this grant does is that it actually provides some funds to our community mental health centers to bring therapy into our schools. During the pandemic, when it was at the height, we were able to still continually have these meetings and these therapy sessions via telehealth. And some schools were allowing the therapist to actually come in and see these kids one-on-one. So again, kids don't have to leave the school. Parents don't have to take off work. They don't have to pay for the gas. And instead of missing a half a day of school, they miss that hour for their therapy session. I don't want to say it was an unintended consequence of this, but a definite positive is that we hear a lot of our liaisons and our counselors and our schools say that this has helped make mental health almost normal. It's made it a little more easier to ask for help because, oh my gosh, it's here in the school and everybody's doing it, right? When we take off this negative connotation about mental health and we start having real conversations, we're seeing that. We had our grant process is about done for this year. It'll go until the end of June. But what I can tell you is that during our progress report that just went to the end of November, so we've added another 4 or 5 months onto this. We have served this year alone over 4,300 kids in this program in 55 school districts. Diane was talking about foster care students. We've served over 450 foster care students when it comes to these kind of programs. And if you ever want to have a good cry, if you ever want a good cry, right? And I feel like in 2022, sometimes we all need a good cry every once in a while. Sit back and listen to just a couple of the success stories that our districts are bringing us. Whether it's, hey, this student was being referred daily to the office, multiple in-school suspensions, multiple out-of-school suspensions. We were able to refer them to this program. The parents were on board. We got the waivers filled out. The therapist comes in after 5 weeks. He's been receiving therapy for 5 weeks, and he's been referral free for 3 of them. He's not missing class. He's staying in class. He's able to regulate what he's doing, and he's now succeeding and thriving in school, where without this program, he'd probably have been out of school suspended again. And especially in our low socioeconomic, high poverty districts, they're going to the gang world, right? The safest place for our kids, the safest place for the ones we love right now are in our schools. And so listening to districts and to our liaisons say things like, this kid was going down such a horrible path, they were going to commit suicide. There was plans to commit suicide. And because of this program, they were able to open up and talk to therapists and talk to their parents and do group meetings and whatnot. And now they see the hope, they see the light, they want to be at school, they want to be with their friends, they want to live. And so Diane and I have these conversations all the time about, it's a $7.5 million grant right now. And I tell you what, one kid, if we save one kid, it's worth it. And hearing the response we get from our 55 districts, hearing the emails that I'm getting now from everyone across the state of Kansas saying, we want to be in your program, we know it's doing good things. And we know districts have used their ESSER funds to help set up kind of a model program like this, not one sponsored by KSDE, not a grant one, but one that they've done with their ESSER. And so they are really looking forward to being able to get on if this program is to expand. But just real excited about a lot of the things that this program is doing. Again, more so than not, just normalizing mental health, normalizing the fact that it's okay to not be okay, and it's okay to ask for help and to get the help that you need. So I will turn it over to Diane to kind of talk a little bit more about where we're headed, where we're going, and everything else that I missed.
Thanks, John. And so many people on this in this group have participated. Sue Mernan with the Association of CCBHCs is a part of this committee, and she was there day one and in Burl's office as we put together the progress report. Judy Rodman, who at that point ran PACES and sitting in her office and talking about how to help PCK public schools and the great need there. Misty Chernowski met with me and walked us through her wonderful Peace of Mind Festival. So if anybody wants a cookbook on how to do a community event around mental health, just talk to her and probably others who are on this. One of the things that we have looked at, we measure 4 things. We measure 4 things on our side because we know our community mental health partners keep lots and lots of data. On our side, we look at 4 indicators for whether or not that are of concern to the school. And we pick only those one or more of those indicators that we are concerned about with the kid. So it is attendance, externalizing behaviors, their academics, and then internalizing behaviors. So we can have a student who knows how to do school really well, and they get A's or B's. They're always there, but they have depression and anxiety. So on that student, we would only be looking at the internalizing behavior. And if I can share a screen really quick. So this is the report, and this is the report that we provide, John and Craig provide to the legislature. And so this is just a report for this year. So it's not for all 4 years. So, and it's a mid-year report. So again, looking at the number of students served. And if you look at the number of students with improved attendance, so we have 70%, 73%. That means if that was a worry, if it wasn't a worry, they're not in that column. So this is the information that we look at and that the legislature looks at when they are analyzing kind of this program going forward. I just wanted to share one concern though. One concern that the legislature has is competition, and competition on social workers, who we celebrated at the beginning of this meeting. So there actually has been a legislative post audit on school districts and kind of their hiring practices, if you will. There's going to be a follow-up on that. But what we do know is that workforce is an issue across behavioral health regardless. And so for our students who are receiving services, there's a lot that we can do at the school level to support that service. And so depending on a person's licensure, they can support what's going on. They can do groups and things like that. So I think I just kind of throw that out as an ongoing conversation. Back to you, John.
Yep, I think that's a great job of kind of putting a bow on everything. We're here for questions. I think we're slated to go till 10:30. And so if there's anybody who has questions over the program, who wants to get involved, again, we're waiting on that legislation piece to put the pen to paper or give us the wink, wink, nudge, nudge, and we'll be sending that application out to everybody. Someone put in the chat to put it to SPED directors. I've made that note as well. So that's going to happen. But any questions over the program or anything that you guys have questions over, be glad to answer it right now.
Well, thanks to Diane and John, a lot of good information. I think it's always good to look at that report card. And I think you all have picked 4 good categories to look at. You know, the thing I liked that you said also is by having the kids to be able to have their sessions, whatever kind of sessions they're having in the school, really kind of takes some of the stigma away, which is certainly a positive thing for our kids and our families. So I think there's a lot of good things that are coming out of this. I do know, because I've heard frequently about this, is there's a concern about, you know, how do we best utilize our social worker staff? I mean, there's different licensure requirements as far as social workers are concerned, and actually KSDE does not license the social workers. It's another department. So at some point in time, if the council would like to, we might want to delve into a little bit and understand a little bit more about the different levels of social workers, and maybe hear from some folks about, you know, how do we look at best utilizing folks, because, you know, there's always a shortage of social workers, whether it's in our schools or in our community services providers out there. So the council might want to kind of take a look at that and see if we have any recommendations we want to offer folks. So that could be a future topic that we want to delve into. Do we have questions for Diane or John on as far as the program's concerned? And there will be more information coming out about that. So if you have a question, we've got a few minutes, just unmute and ask your question, or you may have a comment. Identify who you are, because sometimes your picture doesn't show up in my little box. So if you're speaking, identify who you are, and that would be helpful.
This is Kirsten Ruckosmeyer. And John, just a quick question, and maybe you have the statistics on it, but sometimes I worry about the number of rural schools that really participate in some of these activities. I mean, my experience, and I have a lot of rural schools, is they just sometimes are in a little bit of denial, I suppose. And then sometimes they just don't always have the internal support to just really get on top of the program. Do you have some information on that?
I don't know if I have exact stats as far as rural or non-rural schools, but I can tell you that we have a lot of Western Kansas schools. We have a lot of rural schools who have, they form, I think Diane and I call it a consortium, right? Is that the big word, Diane? Say, I'm just a lowly policeman. If it's more than 2 syllables, don't ask me to spell consortium, Bert. Don't ask me. I'm not going to do it. But like we have Quinter. The area of Quinter, who has 6 school districts that have partnered together. We have Abilene that has 4 districts that have partnered together. Royal Valley is in on this. And so there are those smaller districts, rural districts that are participating in this program and are thriving. And again, our kids are thriving with it. And so that's really awesome. I hope that answers a little bit.
Yeah, it does help. I knew about Quinter. I was going just a little further west, but Kurt, he's really taken that on as the superintendent at Quinter. To really pull a lot of that together. So, okay, thanks.
Well, and I think with that, maybe, and I don't know if the department's going out and doing summer road shows or whatever they do, but, having some folks in the rural areas, I mean, the Quinter folks or Royal Valley folks or the Abilene folks talk about the consortium and how they put that together and how that works. Because, the urban areas, sometimes it's a little easier because we'll have some folks, but, it's not always easier because there's more people. So, but that doesn't mean there aren't mental health needs in our rural areas. There are. But I think, Kathy, you kind of alluded to it. Maybe some folks don't want to talk about those things, and this program makes it a little easier to provide those services. So, yeah, I think a good point there. Other questions? I thought I heard somebody else come on also.
It was me, Kathy. This is Jane. Yeah, hi. John and or Diane. I'm just sitting here thinking and wondering if a family, I know the student can receive services at the school, which is a beautiful thing. Say that a whole family wants some therapy or needs therapy. Does a family also meet at the school, or is that like, does it cost them, or does the funding covering that, if that can happen?
I'll take that, John. So certainly Representative Landwehr at the very beginning wanted us to identify siblings and families who are also in need. I'm not aware of any families that participate and receive services at the school. However, what the liaison a lot of times is able to do is kind of help bridge that gap. So if your phone rings and it says Paces or Compass, sometimes people are little residents answer the phone, but if it says, Central Elementary, they'll probably answer the phone. So the liaisons help with that communication piece. And I usually ask that question when I go out. It's like, do we have any family therapy? And some of them are, participating in that, but I think that usually happens either through case management or at the center. So, I mean, it's all good. It's all very important.
Thanks, Diane.
If I might, Kathy, on the question about rural schools, whatever the definition of rural is, I was in South Barber last week, and it's like 1 mile from Oklahoma, right? A stone's throw away. And they're able to have a therapist come in part of the day, and that's where our workforce challenge is for all of our CMHCs. But for many of our rural schools, it's teletherapy, and it's done by Zoom just because of the drive time. It's just kind of unreasonable, that 24 miles to Plainview and then another 20 miles to Stockton to be able to come in. So the liaisons really help with that, making sure that it gets set up and scheduling around. So we're not always missing math, or we're not always missing PE. The only reason I come to school is to go to PE, that kind of thing. So liaisons really kind of help with all of that organizing and scheduling. And again, it saves a lot of time And to Jane's question about family, every 90 days, the family needs to come in and participate in the 90-day treatment review plan, or after time, the case can be closed. So again, the liaison tries to help bridge that gap, kind of explain why this is important, kind of, we're all part of this, and why we need to come for that 90-day treatment plan. A lot of moving parts, smart people in the buildings doing all that.
Other questions or comments for Diane or John?
Just to kind of go back to that rural side of things, and I work in a rural school district, and we actually go through a community health center, and we had kind of went off on our own and partnered with them, and so it's a whole different kind of program that we went through, but it is very successful, and they have branched out, and I know that they're working on branching out, and just those rural schools they're just apprehensive of what that is going to look like and how is that going to affect our parents and our students and just the nervousness part of it. And I think Kathy, I think like a roadshow or something put together just to let school districts know about like, what's that look like, or to have those schools who have been through it to be on, I don't know if you could do something a video wise of just how that's been successful for them, just to kind of help with that nervousness of it, because I think that stigma is still very much out there, but just letting them know like the success part of it and how awesome it really is for students is important.
I would think in a lot of districts it's particularly important to have a champion to help it, just like Kathy Ko said out in Quinter there. I think the soup was kind of the champion. You've been down in your area, and I think typically you'll find somebody who's kind of a champion that the folks in that community trust. And then there's a little more, again, that person can kind of help drive the program, but there'll also some support from the community. So I do think that's important. Just from an outsider looking, that's important for some of our programs that are maybe in our other areas of the state to have. So thank you, Misty.
And I think Misty brings up a great point. John, if you guys do a roadshow, and there's more than one model out there. There's several great models. And so having that, laying out what different districts are doing and how they're doing it, like Misty's district, I think would be a good idea.
Well, and I think that's a good point, is all the models that are out there. People can tailor it for their community. I think there's a certain number of critical components you've got to include in there, but you can still tailor the program for what works for your community.
Again, this is Kathy, and I like all those ideas because I think sometimes even it's a fear of how to just get it started.
Mm-hmm.
Yeah, one of my favorite quotes is, how do you eat an elephant? One bite at a time. You got to take that first step. And especially when we talk about mental health with our kids, the hardest step a lot of times is that first one of admitting, hey, we need help. We need to do something. And sometimes that's the hardest part, is just doing something.
Other questions or comments? We've got a few more minutes. We could always break early, but John's raised his eyebrows when I said that. Any other questions or comments? I've been taking notes as we've been talking about possible future. So if you see me writing over here, I'm not sending written notes to anybody, but I'm jotting down ideas for future agenda items, and we'll kind of get to that later on the agenda also. But I think we've come up with some ideas that really could provide some opportunities. Diane Gerstad did put in the chat that the USA Kansas meetings in June would be a great opportunity for this. That's true. Yep, good idea. Because those
Madam Chair,
meetings. Kent.
KSDE sponsored summer academies during the summer period. And this year we're going to be in Manhattan, Goddard, and Garden City. And we have two strands. One is for SEL and one is for school counseling. Melanie Scott is one of our trainers for that. So you'll have a member of the council at each site. And we can certainly talk about the issues that you guys have raised. But more than anything, just try to create greater awareness.
Yeah. Well, and then let folks know about the opportunities, because we've got opportunities for expansion coming up.
Yeah, and I might ask John. John, has anyone reached out to you to be a part of the Summer Academy project?
They have not yet, but I would be arms wide open to help out. Absolutely.
I'll follow up.
Thanks, Kent.
Great. Anything else for before break? I shouldn't say that because when I say break, everybody, oh no, I'm not going to be the one that's going to slow down break. Now I've done these meetings enough. I should know that. To slap my hand. Okay, well, I think we will go ahead and begin break, and we are scheduled to come back at 10:45, and we're going to have Amy and Carrie are going to be on to talk about the SPDIG application and explain a little bit more about that. That's another good program that's going on.
Just Carrie.
Yeah, Carrie. Oh, just you?
Yep.
Okay, well, we will welcome you to talk about this particular agenda item. So if nobody else has questions or comments, we'll go ahead and break, and then we'll be back at 10:45.
Kathy, can you stay on just for a second?
You bet.
Ken Huey is retiring, and
Okay.
he completed a form, and he said he emailed it to you recommending that Dr. Jessica Lane from his department at K-State would replace him. And I just want to make sure that you get that.
Okay, so it's from Ken.
Yes,
Do you know when he emailed it, like today?
this morning.
Okay, all right. Oh, there, I see it. Okay, thank you.
All right,
Appreciate it.
thank you.
Uh-huh.
Hey, thanks for your help yesterday. You're a mute.
They said that is the saying of 2021 and 22. You're on mute. It's true, but I'm in the hotel room trying to see if the internet is going to be steady.
Oh, well, it's, who knows, right? It could be better than what you have.
True. It's true. Well, great surprise for Shanna.
Yes, that was fun.
Good job.
So we're all crouched outside of her office during all of that. Well, and Randy was down here, and then the internet went down. Remember? So all the KSDE people went off. So I'm like, telling them where we're at. I'm like, any minute now, any minute.
I thought I saw her once kind of look over her shoulder, and I thought, is she kind of hearing stuff or something like that?
Yeah. So
Well,
that was fun.
You pulled it off. Good job.
I am not very sneaky. Good at that.
You were on this one. It worked. It worked.
Oh. Tamara did a fantastic job delivery at the special ed administrators meeting last week.
Yeah.
It was the first time I heard Tamara in person.
Good.
Because I've heard. So.
Yeah, well, she loved it.
Welcome.
She enjoyed it, loved it. She is just, I think, a great presenter and knows her content.
No, absolutely.
Yeah.
And you know, it's harder to pay attention when you're in person than it is online.
Really, Carrie? Really?
Well, maybe just for some people.
Yeah.
Yeah. For people that are distractible like me, this is good, right?
Yeah.
That's
one thing to look at. One thing to look at.
Yeah. As opposed to all those other distractions
Right.
in the room.
True. Oh, I like her hair. Oh, that's a cute dress.
I'm like, why is everybody wearing tan shoes?
Right.
I don't even have a pair of tan shoes.
That's funny, Carrie. That's funny. Yeah, we get our style from that.
Mm-hmm. Yeah. So now I'm like, do I need a pair of tan shoes? But it looks like you're not wearing any shoes at all.
Yeah, right.
It looks from a distance, it looks like you're barefoot.
That's funny.
Oh, now this means I'm old.
You're not.
Oh, maybe that's what that is. Since the kids they can't go barefoot now. We used to go barefoot.
Oh.
Mm.
So they're wearing tan shoes to look barefoot.
Safely.
Right. Oh, that's funny. See, I'm more distracted, I think, on Zoom because there's, so many people. So I might glance at my phone, whereas if I'm in person, my eyes are on the person because I don't want them to see me looking at my phone.
You know, I heard a story about that just yesterday, Jane. They were
What was
saying,
that?
the person was saying that while people are describing themselves as sort of burned out on Zoom and WebEx and all these online meetings and stuff, her take was they're not burned out on the Zoom. They're burned out because they're doing so much multitasking while they're on the Zoom that's why they prefer in person. It's not this format itself. It's all the other things that we're doing while we're on this format. So I thought that really made sense.
It does, John. That's interesting.
Yeah, she kind of described what I was feeling. Like I do prefer in person, but maybe not because of this, but because I can kind of focus on the conversation.
Yeah.
And not all the other stuff, you know?
That's true. It is true. Good point.
I thought that was a good take.
It is, John.
It was during the mandated reporting session that took place yesterday. It was like a 3-hour training. It was fascinating. There was over 500 people on that virtual training. It was really, really good.
Who did the training, John?
Oh gosh, I'm gonna have to look and see. There were a number of different people.
Rochelle's
Trauma
on.
response and racial justice.
Rochelle said we hosted it. I think that's
Yeah,
KCFL,
it was.
right?
I just saw it was Rochelle.
Great.
We coordinated
I thought
it
it
as
was
one of the special topics for Child Abuse Prevention Month, and I'm still wading through the registration and attendee list, but I think we're up to over 500 people. So
it was great training.
That's
I would appreciate that every year.
Yeah, I think it was so well received that the speakers were from the Institute for Trauma and God, I'm going to totally butcher it. Institute to Transform Child Welfare, I think is what their name was. I can link them in the chat, but I think it was so well received. It was really talking about the shift, you know, from reporting to supporting and all of that language. And I think we're going to try and bring them back for the governor's conference so we can have it as part of the Institute session. So the second day we can have more in-depth conversation with Kansans in group work. And then we're also looking at bringing them back just for another opportunity for others who weren't able to attend. So
Okay, with you guys talking about that, I'm going to ask you during agency updates to include that. Okay, since it sounds like it went extremely well, and if you're going to do another session, that's great. So you guys, and then you can have John be your testimonial about how good it was.
Well, I thought it was powerful and really, really well done. And so thank you. I just saw your name when you said something. So nice job.
yeah, I was thankfully not the one having to present yesterday. I've been doing a lot of trainings this month, and I actually have to hop off. Speaking of agency updates, well, that's going to be at 1:15 because I do have to hop off at 1:30 because I have a training that I have to do this afternoon as well. So,
well, I'd almost guess looking at the agenda, we may be done by then. So,
okay,
I think you'll probably be good.
Yeah.
And we're getting pretty close to time. I don't know if everybody's back on or not.
We just started chatting early, Kathy.
Yeah, no, that's good. That's good. You know, it's one thing I missed about the in-person sessions is all the informal networking that we got to do. And so you guys were networking on Zoom.
Well, we were networking about shoes for a little bit. So that was a little off topic.
I heard about tan shoes, and I thought, I don't know if I've ever had a pair of tan shoes.
I stayed out of that conversation.
But if you go.
Uh-oh, Carrie froze.
Uh-oh. Hopefully that wasn't all KSDE.
I hope not. It says we're reviewing Kayla's screen.
Kent, are you live? Can we hear you, Kent?
Yes, ma'am.
All right. Kent.
But I'm offside. I'm not in the office.
Oh.
We have a real problem when 4 of us are on a Zoom or a presentation. The QB system just doesn't work.
Okay, well, I see Kayla, so KSDE must be on. Kayla, are we
all-
on?
I believe we're all on.
Bert's given thumbs up.
Okay, all right, very good. Okay, well, it looks like we're back. We're back in session for at 10:45 for our meeting, and we're going to start back. A few folks have had some good informal conversation. We're going to add an agency update lately with a couple of the informal conversation. Okay, so we've got Carrie Haig is going to be on, and she's going to update us on the SPDIG application. And she'll even tell us what SPDG stands for. Carrie, are you there? She was.
Go knock on her door because I can hear her talking and she doesn't realize she's not on.
Oh dear. Poor thing. I know SPDG stands for State Personnel Development Grant.
There you go. We got Jane to help us out there.
That's all I know.
Well, and our partners on that grant are Families Together and K-Perk and Cherie's team with the School Mental Health Initiative.
That's
well, we're getting all sorts of good information while Carrie's offline.
Cherie, you want to jump in?
She's logging back in.
Okay.
Seems like she got logged off and then Zoom updated on her.
Oh gosh.
So now she is trying to hook back up. It's saying that she's coming on, but it's taking a long time.
Well, I might point out while
Now I'm here.
Are you here, Carrie?
I'm back now.
Okay, Carrie's back. So, you know, the wonders of technology. So welcome back, Carrie.
Thank you. So my Zoom is now updated, but my shoe wardrobe is not. After having our first in-person meeting with special ed administrators last week quarterly, one of my observation was that I have no tan shoes in my wardrobe, and there were lots of tan shoes across the room, but I have none. So that's what we were talking about during the break, about, you know, when you're virtual, you don't see each other's shoes. So I have a need to go shopping now. So the update on the State Personnel Development Grant, for those of you that this may be new to, in the Individuals with Disabilities Education Act, there is an opportunity for state departments to apply and receive funds that purposefully are intended to build the capacity of the state education agency to support personnel development across the state. So Kansas has had one of these grants. And then every 5 years we reapply for it. So the previous applications we've had have done things such as supported the development and installation of behavior integrated into Kansas MTSS. It's also supported our development of our co-teaching state trainers that we have across the state, and then our early career mentoring for special education teachers. So those are some of the examples of the efforts that it has helped start. And then most recently, the effort around professional learning has been around school mental health. And so our intention is that our next application would continue to focus on supporting the professional development needed for school mental health within school settings, and similar to tied to the conversation we were having before. We've established a good approach and for having district community leadership teams. And with the next application, we hope to then be able to, expand that and increase the implementation of that across buildings and districts, and that we can move that work to be so that the work from the previous years for those districts that the school mental health implementation state team's been working with, that they then would also be able to mentor and mentor other districts, and then also continue to provide those high quality professional learning products focused around not only trauma, but moving into really the neuroscience side of things. So Cherie Blanchette is on here, and in a few minutes, she is going to give an update on that work more specifically. But the reason this is on the agenda is we thought there would be an RFP out, but it is not out yet. So we are waiting for that. We're still preparing and doing everything we can to be ready for when the actual grant application is issued, but it's not out yet. But we still have lots of work to do. That's my update with that. But then Cherie and her team, I'll defer my time to them because Cherie has the good stuff, information.
Real quick, Carrie, when that grant comes out, so what's kind of the timeline to get, will they give you the timeline then, or?
Oh, we'll probably only have like probably 60 days to turn it around and submit it. So
pretty quick.
Yeah, it'll be fast.
Yeah, okay. Okay, Cherie?
Well, hello, everybody. Feels like it's been a minute. I heard some great conversation this morning. Got excited. It makes me miss joining you guys on a regular basis. I'm like, oh, so many good connections here and so much good work taking place. I'm going to share a couple of resources in the chat. One that wasn't really related to the update that I'm giving, but you all mentioned the credentials and qualifications of at least school employed mental health professionals. And we have put out a resource several years ago now. It really does need updated, so I hesitate to send it, but it will, it might give you guys an idea as to kind of where you can start for gathering that information on the requirements of at least your national school employed mental health professional associations. And there's some others that needed added in there. And I could see, adding in more information about CMHC staff roles and what have you. But there's that resource in case it helps to spur some ideas. The last two links that I shared in the chat, one is to our School Mental Health Initiative webpage. Here you can find several of our resources and handouts and see about some upcoming trainings that our team is facilitating. And the one that I would really encourage everybody to check out is that third link to our Moodle page. You do have to create a login, but once you log in, you will see that we have several virtual trainings put together. And I'm going to say these are high quality virtual trainings, right? We utilize best practice for online learning. These are chunked out with checks for understanding. And so that participants are getting immediate feedback and we can actually see the progress that's being made across teams. There's several trainings in there, but two, well, maybe I'll say three. One training that is universally accessible, not just to professionals that are working with schools, but also, you could have, anybody from a community mental health center or a PRTF or what have you. Thank you, Carrie. That they could also take and utilize. One of them is called our Trauma Responsive School Communities module, or it's a series of modules, I should say. What I really value about this is not just, it's funny because I'm talking about virtual training here, but a sit and get and what I mean by that is there's a facilitation guide that accompanies those modules. And they can be completed either as an individual. So let's say you're a teacher or somebody in a school district that not everybody is going through these modules, but you want to go through it by yourself for application purposes. You go through it, then you actually have a reflection that you do, and then you actually develop an action plan, like what are you going to do with this information based on what was just learned. How a lot of our teams are utilizing it, and I'll share, maybe I should back up and share a little bit about that with you all, is we have like entire districts and community mental health centers that are going through this together. They have it built into their professional development time. They have ongoing coaching to support what's been learned. They have a plan in place for when new staff onboards that they actually go through the modules so that everybody is utilizing the same language, has at least some base level knowledge. And it's been very successful. We've even had one of our CMHCs take and adapt it to make it more universal so that it's not just targeting professionals that work with schools, but all of the staff in their CMHC. So they're actually training their janitors, secretaries, everybody, because at the end of the day, when we look at ACEs and trauma, we know that it's generational and that it impacts all of us. And it's just getting that information out there has been really helpful. So for those of you, if there's anybody that's new on here, yes, I'm Cherie Blanchett, and I coordinate the School Mental Health Initiative. And Lee Stickle is the project director for this initiative. And I've not actually looked to see if Lee's on here. But a little bit of background for you all. We, I previously worked under the Autism and Tertiary Behavior Supports team, which is a TASN project that provides technical assistance to school districts around a challenge they might be having with a particular child or youth. So they get called in, when a school is really struggling with what to do. And more as those requests for technical assistance were coming in, it was being identified that while there may be some symptoms of that, reflect autism, that really a lot of things that they were seeing relates to mental health and trauma. And that's kind of what got the ball rolling for the School Mental Health Initiative. That's a really small part of what got the ball rolling. But that's what we do. We also started about the same year as that mental health intervention team. And it was funny, kind of crazy. I think it was Diane, you said something about 4 years. And I'm like, oh my gosh, has it been 4 years? What a whirlwind. Just a flashback even because, so much has happened in all of our lives, notwithstanding the pandemic since then. I actually am really excited. What got me excited about listening to this morning's presentation was the potential for alignment across these state level initiatives. When I hear about the work that the MHIT team is doing, and then knowing the work that our team is doing, I really see the potential for providing some cross training and really strengthening the work that we do together. We are currently in 5 regions. We go by regions, and that refers to community mental health center regions. Believe it or not, the State Department of Education kind of breaks things down by school districts. With our CMHCs, we know that they have different kind of school regions, but CMHCs we know serve several different districts within their region. And so they break things down a little bit differently. So we go by regions. We support, I'm going to start with the CMHCs, Pawnee Mental Health Center, Crosswinds Counseling and Wellness, Central Kansas Mental Health, Sumner Mental Health Center, and the Center for Counseling and Consultation. The districts that we've been working with intensively include Manhattan, Ogden, Southern Lyon County, Wellington, and Futures, an early childhood program. We've been really excited to expand our experience in working with early childhood and as well as their ability to meet the needs of the children that they have in that program: Caldwell, Fort Larned, and Great Bend. And what we do is we utilize a very structured process. It's merges from the work of what's known as the Interconnected Systems Framework, which basically takes that PBIS framework, which ultimately for us is the Kansas MTSS and Alignment Framework, and just aligns mental health practices within the way that schools do business, using that tiered systems of support structure, which utilizes data, draws upon evidence-based practices. And what we've done is pulled our community partners in to actually utilize that MTSS framework to collaborate and work together. What's been amazing about this is, one, you now have your community mental health centers contributing their data. Juvenile justice, PRTF's one of our teams, our Great Bend team also has juvenile justice and foster care, and a PRTF a part of that team, I'm going to say. But they have all been pulling their data together to identify those areas of their school community that have the most, that require the most attention or need, whether they're breaking that down by here's our buildings that need more support, or here's the training that we need. One of the most, I'm going to talk about Manhattan and Pawnee here for a second, because what's been amazing there is when, we had reached out and had established a partnership with Pawnee and Manhattan to work with them. And then they wanted to bring on a mental health liaison via the MHIT program. And we couldn't have been more pleased, because the superintendent there, Dr. Wade, when he went to go post a position for that liaison, he actually wrote in the job description that liaison would be a part of the district community leadership team, which are the teams that we support. And so it's not seen as two different things, but we are truly working stronger together. A little gem here for you guys. One of those liaisons who is participating with MHIT and our program is on the School Mental Health Advisory Council. If you've not tapped into her yet, Sam Brown, wow, I cannot say enough good things about that lady. She is amazing, and a former special education director. She is on it. And she like I said, so she's a liaison. She's been working closely with our team. We've even pulled her in to help us with some of our content development, because we're always responding to the needs of our individual communities. Sam's been amazing in a process that we utilize that I think you all might find interesting. We refer to it as, and it's one of the modules in our Moodle, but it's the trauma responsive support planning process, which essentially is I'm going to call it, I don't want to say a revised version, but we utilize all of those best practices of your traditional functional behavior assessment, but we pull in all of the trauma pieces that were missing before, based on, what we do know about neuroscience and how it impacts, the bio, psycho, and social aspects of development, growth, and functioning. And we have actually watched Pawnee and Manhattan, their special education director and their CBS director, get up and co-train on this process to the buildings in their district. The buildings in their district, at each of those tables, you guys, this was phenomenal. It was, you had an administrator, the building principal, you had their school employed mental health professionals, special education staff, and the CMH and your CMHCs, or the CMHC made a point to have a case manager at every single table when they went around to talk about planning how to support children and youth that were receiving services across systems. So rather than the school just conducting an FBA and then writing up a behavior support plan, this process actually requires that you have a school and a community employed mental health professional. In the case of Great Bend, they actually had juvenile justice a part of this one. Interestingly enough, juvenile justice had the best relationship with the parents and were the ones who reached out to get permission to do this work. But you actually do the assessment collaboratively. and you implement the plan collaboratively and progress monitor for progress across all settings. So you are getting the voice, and I would say there's an emphasis on self-determination. We talk about this a lot with children and youth. Self-determination, meaning what are their goals? Because we know we love to sit around and write goals for kids that aren't theirs. Could be part of the reason why they're not always successful, but self-determination. Person-centered planning. So you've got teams that are coming together and saying, hey, we can't just fit the kid into this system. We've got to change the way we're doing business to support the kid. It emphasizes voice. So you've got the parent voice, the child voice, everybody's interviewed in this process. And then, literally across settings, so that you're not just learning a new skill or have supports in one setting, but across all settings for generalization. So I just really want to give a shout out to that actual process, because it has been amazingly successful. In fact, we will soon be training even our TASN projects, ATBS, Autism and Tertiary Behavior Supports, and our MTSS and alignment team in that process as well, because of how successful and effective it's been based on that, on the neuroscience pieces, which Carrie was referencing earlier. So that's, and what I guess I just was listening this morning and thinking I am, as Carrie mentioned, we haven't seen the new application come out yet. I can tell you I have big dreams. Should we be able to move forward with this work? A couple of things that I've seen. One is, as we've gone out and we've trained individual teams, one of the challenges that we run into, of course, and you guys know how hard it is to roll a program out within a district, right? At the district level, you're trying to get all of the buildings to implement with fidelity or, validity, you want, reliability, you want all of these great things. And you know how hard it is to roll that out within one district. Our community mental health partners, our CMHCs, PRTFs, juvenile justice, foster care, they serve entire regions, you guys. And right now, if we're lucky, they're sitting on one of our district community leadership teams, which is still pretty big, right? Like, as in it covers a lot, a large area of space. But what I'd really like to see happen, we get calls all the time from, there's some great grants going around. We get calls all the time from other people at the state level doing work similar and wanting to know, how do we do it? What do we do? How can we fit in? I can really see the potential for some cross training and alignment across all of these initiatives, so that we are working more efficiently and stronger together, so to speak. So I really see part of the focus as being on the capacity of our community partners. So rather than training one person from juvenile justice at a time, or like in Sam's case, one liaison at a time, that we could really train several people at one time on a really small scale. I can tell you how effective that's been. Wellington and Sumner County Mental Health, which I don't know how many of you know Rick Gaskell, or we're big Rick Gaskell fans, but that man retired. And I tell you what, I think we've got to bring him out of retirement. But Sumner County has been a real champion for the work. But that very first year that we were out there, which you all not know, that messy first year, right? We were out there. That team was one of our most successful cross-system teams. They were just one of our most successful. They were really leading the way and keeping us on our tiptoes. At the end of that first year, there was turnover on the district side, special education director, and the behavior person who was, liaison to the buildings. And we thought, oh, crap, we are going to have to start all over. That was not true. Our CMHC staff was trained. They were passionate, willing to go. They jumped in there and really got the new professionals hired by the school district up to speed on what to do. And they are continuing to work together. This is an area where we work with the early childhood program, who's now collaborating with the elementary people to make sure that those trauma responsive support plans are carried over and monitored all the way up to the high school. So it's functioning like a well-oiled machine. I'm horrible at those sayings, so I shouldn't even try. I'm going to go ahead and stop there for a second. This was really just kind of an update on the work that we were doing. I did just send, didn't want to overwhelm you guys, but did just send Kayla our last quarterly report that was shared with KSDE leadership, which outlines all of the work that we're doing. Down at the bottom, you can even see our crazy calendar, which I should say right now this week, I'm joining you from a hotel room. We are on site with all of our teams. We stay in 5 hotels and 5 nights. I really should quit telling people that because they get a little too curious about what my job really is. And I'm like, no, really, I'm meeting with professionals here, people. So there you go. That's it. We are so passionate about our teams, so passionate about the work that's being done. And just again, listening to Diane and John earlier talk and just kind of having this flashback, I've got to say, you guys, regardless of what happens next, it's been a journey, and where we're at today, while there's still a long ways to go, we have so much to celebrate. So thank you guys for the work that you're doing.
Sheree, there's a question in the chat from Leah. Leah's with Families Together. She said it's super exciting and great work. What person-centered planning process/tools are you using?
Oh, Leah. Hi, Miss Leah. Leah, as you guys know, we also partner with Families Together and our Kansas Parent Information Resource Center. They've been phenomenal throughout this journey. The person-centered planning process that we utilize is, so back in the day, probably TMI. So, I've got a strong background in PBIS, worked with KIPBS for a while with Dr. Rachel Freeman when that was going on, but person-centered planning has been around for a while. A lot of people think they're using it, kind of like they think an IEP meeting is wraparound, and that is not the case. Person-centered planning is really, truly about that child, and it is driven by the child. One of the websites that our teams have been getting excited about recently, which I think is kind of funny because I geek out over it, but it's one that it's been around for a while. But if you guys haven't seen it, in fact, I'm just going to type it in here right now. It's imdetermined.org. I believe that's it. I hope it's right. But it's the site, it basically has tools and resources for even, at the elementary level, you guys, they've got kids a part of their IEP meetings, and they teach them how to put together their own PowerPoints and presentations and voice their own needs, and learning to start facilitate that at an early age. So you're going to get a lot of tools and resources there, Leah, but how we have it implemented is within that trauma responsive support planning process, which again is one of those modules in Moodle, but it is, again, I can't emphasize it enough. It's child's voice. We all have our own ideas of what a child or a youth needs to be successful. We have our own ideas around what will help, them improve, but we never really utilize their voice. And then we are constantly having them, fit within the confines of our system, not necessarily, the system to their specific needs. And without going through the training, I don't know if I could break it down for you anymore, but hopefully that website will give you some good information on it. And then, so let's see here, ideas about sharing training in future. Yes. Okay. I do have that idea. I'm serious. I think I've mentioned that several. Yeah. Shannon and I met the other day, and I'm without you guys. I don't know if somebody else was thinking it along the way. I'm like, if I'm being honest, Shannon, we need to be training our community partners too. Because those are the masses, and being able to provide some training and some coaching to them. Of course, all of this depends on, one, the grant coming out, to one, at accommodating, the time for that. But I really think that is where we could get a bigger bang for our buck. I say that wrong, sorry. And then one last thing I keep thinking, about our teams. Also, we've got, I know Shanna's been doing some work with PRTS. I'm really hopeful that within, maybe by the time of the next meeting or two, our teams, our district community leadership teams, would really value an opportunity to present to you all on their experiences, because these teams have been doing a lot of work with PRTF partners to refine and improve that process, that transition process. I say transition process, the process of, when a child goes to a PRTF, but really that piece of when they come back out, of which there is absolutely no plan. People don't, know what's happening. But anyways, they would love an opportunity to share with you all their work in that area. And I'd like to do that in collaboration with Shanna, and see if we can't, together with the support of this advisory council, continue to improve on the work that's being done there. So thank you, Carrie. We're glad to know. We have our team, I think we'll probably, I don't know that we know how to stop. This might be, so technically the grant ends September 31st. And if you look at when Kayla gets a chance to send out that handout, you'll see we don't know what slowing down means or wrapping up. We are actually gearing up to keep going. So yeah. Lee, did you want to say anything?
No, thanks. I'm just listening in. Appreciate everything that your team's been able to put together and the support of the School Mental Health Advisory Committee.
Glad to have you on, Lee.
Hey, Kathy. Glad to have you on, Shuri. No, thanks. No, I'm kidding.
Okay, so a lot of work going on there, a lot of exciting work, and it looks like to me there's some real future opportunities to have some more presentation and get a little bit more aware of some of what's going on with your team with the School Mental Health Initiative. So really look forward to that. So yeah, you might kind of talk with Carrie about some options of what would be some future presentations as we look for how we can, it's kind of like we've got a good start. We just need to figure out where do we take it and how do we go to the next level.
I think more than ever we are about. I think we're ready, and I say we. I mean, like this team, this School Mental Health Advisory Council. Again, I smile at the past 4 years. I think that we've all kind of now got a more solid ground underneath us to actually be able to come together and strengthen our efforts. So,
and we've got a good group of support from all sorts of agencies on this council, which is one of the things that I think gives it its strength.
Kathy, I will go ahead and interject here. It was one of the things I was going to update people on later, but that's kind of how we're going to start the new year off, since we're able to meet in person. In our July meeting, we're going to do obviously some networking, since we haven't seen actual real faces in person. But we're also going to kind of revisit our mission and vision and our purpose of this group and what direction specifically that we want to focus on for the next year. And definitely some of these ideas are in there. So I have all of these notes so that we can talk about that.
Great. Cherie, anything else? Because or Carrie, as far as your comments or questions or anything else you'd like to share with the group for today?
No, just thank you guys. Miss seeing you. I know everyone's excited to meet in person, but I haven't even seen you guys online in a minute. So
sounds like you've been a little busy.
Oh yeah.
Doing good work. So we really appreciate the work, and like I say, hopefully we can kind of figure out how to present some of that information to the council, and then the council will kind of think about, okay, how do we start getting this out and coordinating this with other groups and expanding on that. So really exciting opportunities when you think about that and how we move to the kind of the next level, I guess.
Yeah.
I think.
Exactly.
One of the things I can, I'm going to birdwalk just a little bit, but I can remember when I was back in schools as a building principal, and Diane, I heard Diane Gerstead, it says something about getting records within 3 days. Well, I was lucky if I got records on a kid within 3 months. So being able to have opportunities to actually get records, let alone have conversations with folks to talk about what the needs are with a kid, especially some of our high need kids, and we want them all to be successful. So the opportunities to break down some of these barriers that even we're doing on this council and stuff, and networking and problem solving, how to do these things, I think is so extremely powerful, because these kids, they're our kids, and by our I mean the collective our. That's not only the school, the parents, but also the community, and how can we help provide resources and the support so they'll be successful. So I think this is exciting to keep moving forward. No standing still. Okay, any other? Got a note from Diane too. We can plan to share resources next fall to the MHIT liaisons tool also. Okay. Okay, so anything else for that? I believe we're good. Jane, I'm gonna turn it over to you. You've got a little information to share with us now.
I do. Hello, everyone. And I want to build off of what was just shared in terms of thanking corporately, so to speak, Carrie Haig for being that SPDIG, we call it, State Personnel Development Grant Writer, because she has led the way on those grants for years and years, and grant after grant. And not every state gets them. You don't get them every time. You're not guaranteed. And so a lot of this work, all the things that she mentioned that were included in past grants, we have because we have a leader in Carrie. And she makes it just sound like it's part of her work or whatever. Yes, it's part of her work, but she does it so well, and all of Kansas benefits. So kudos to Carrie and her SPDIG leadership. The other thing, as Cherie was sharing, the very good work of the school mental health initiative, as KPERC and Families Together have been partners with them, as she mentioned, and part of that. And I've shared with you that some of the different resources that we developed as part of that SPDIG work were things like the toxic stress resource, the ACE, and these were all for families, and educators always use them. We say for families, but educators use them. The positive childhood experiences, suicide awareness, bullying prevention, those resources KPERC and Families Together collaborated on for families, for educators to distribute in schools to families. And that's all part of that SPDIG work. So it all kind of comes together. And as Sherry was talking about those Moodles, when they, from the School Mental Health Initiative, I have taken those Moodles, I've taken them, those, and they're interactive and they are fun. And you learn, I learned. And so those Moodles are worth the time. And I did it as an individual, not a team, just because I wanted to know more and see what they were like. And it's worth your time. It's worth your time. I loved them. So as Kathy mentioned, I am the executive director of the Kansas Parent Information Resource Center, that I'm holding this signage on my shoulder here. But, and so we are a TASN project, and we support the work of engaging families across the state of Kansas. So a lot of professional learning, a lot of professional development for educators. Many times people think we're mostly with families, but we are mostly with educators doing this work of professional learning. Although I'm broadcasting from a hotel room in Garden City, because tonight I am with Garden City Families, and we are on this topic of attendance. And I was telling our executive team that we're getting lots of interest and just requests in this area of attendance, since schools have to, of course, track their attendance and track chronic absenteeism. And so, of course, this work should engage families, and it's fun. It's fun work to talk with them about attendance, and that's some of the work that I'm going to be doing tonight. But Kayla, could I share my screen? And in the meantime, thank you, Kayla. That was fast. Let's see if I can get it up here. Whoops. Trying to pull us up. There we go. I think I got it. There we go. Let me do share sound also. All right. So can you nod your head if you see my screen now? Yay, okay, I see some thumbs and some nods. Good, good. I'm going to show it in this format just because I have found for me, sometimes it works better this way. And I'm going to fly through a few slides and then concentrate on some. So one of the things that we'll be talking about is attendance, and I call it bringing attendance home. Because of course, home has a strong link with attendance or children attending schools. But one of the things that I want to share right off the bat is some new data that just came. It's Kansas data, and that makes it even neater, is that we have some family engagement data from a statewide survey that some districts and schools use, and we crossed it with attendance data from KSDE. And at the bottom, it's 24 districts that we looked at that use both the Family Engagement Survey, which is a free survey tool that I believe I've talked to you before about, but we just updated it. So now it collects demographics so that you can, it's built on the 6 standards of family engagement. And so now you can demographically look at, for example, families of children with disabilities and compare them with families in general. Do they feel as welcomed into the school community? Do they feel their communication is as effective? Because that's standard too. But anyway, I just wanted to share this new data with you because it is really, really exciting. And it is that you can see, I'm sorry for all these little things sliding in here. You can see that the top, the green line says that districts with higher ratings on the Family Engagement Survey have statistically lower percentages of students who are chronically absent. So it makes sense, doesn't it, that schools that are better about engaging families have less chronic absenteeism. So the negative correlations here are good in this graph because it means less chronic absenteeism. And then the other thing that is really neat, and it just makes common sense, is that on standard 1 about welcoming environment and sharing power and advocacy with families, you can see those 2 standards here and here, welcoming down there, I believe. You can see that those have a higher, statistically higher ratings because they, with lower chronic absenteeism, because if a school is welcoming families really well, focused on that, and if they're sharing power and encouraging families to be advocates, doesn't it make sense? Families want to be there, kids want to be there, so they're absent less. They're absent less. So it's really common sense, but common sense doesn't write a grant or things like that. It is data. And this is Kansas data based on the 6 family engagement standards that our State Board of Education endorsed in 2008. So this free survey for districts and schools is based on those standards, and schools get a report back according to each standard. So they can look at, did families feel welcome? Did our Black families feel as welcome as our Latino families? Who's communicated with the best? So that's brand new as of January data that can be collected from this family engagement survey. So it's up there brand new as of January. But this data was from our former survey, which gave us this great data on absenteeism and attendance. And kudos to our TAS and evaluation team that pulled this together for us and dug deep. So in terms of family engagement, it makes sense. Engaging our families well is lower chronic absenteeism. And we want that, don't we? We want it. So anyway, you know me, I have to start out with some family engagement data, but I want to get to social emotional learning and attendance, because I know a lot of our minds and hearts are doing that work. But as I go down and get there, I want you to see that when KPERC does a presentation with families, we talk about school definitions of attendance, excused absence, unexcused absence, chronic absenteeism. What is it? Missing too much school in plain language, 2 days a month or more, or 10% of a school year. So we talk, what is an excused absence? Some samples. What are unexcused absences? Some samples. Then we do some icebreakers. What makes it hard for you to send your children to school every day? What motivates you to get them there? And to hear from families, get them part of this discussion. And then we talk about, did you know that starting in kindergarten, too many absences cause children to fall behind? And then if you look down a little bit more, there's a couple of ones on social emotional. By being present at school, your child learns valuable social emotional skills and can develop meaningful relationships with other students and school staff. So if the children aren't there, they miss out on growing in social emotional skills. So we just talk over these facts. We watch a video that's awful. It's fun, it's informative, a little a child talking. We talk about that video. What did you know? Chronic absenteeism is just missing 2 to 3 days a month, how it adds up. Then we talk about benefits of your child at attendance, you know, their academic benefits, their opportunity to learn from others shrinks the more they are absent. If they're English language learners, like my population will be tonight, a good number of the families, they can master skills more quickly if they are there, if they're there. And then the last one, being part of the school community. And being part of that school community, they're learning valuable social emotional skills from one another, let alone what is being taught in the curriculum, maybe formally, and then the informal, being part of their school community, feeling included. We talk about September. September is important. It's what happens in September affects the whole school year with attendance. So we highlight for families, start off strong, get them there right away. September lays a foundation. We play some games. We play washing the elephant, where somebody's out of the room, they're on chronic absenteeism, and so they miss what we're doing. And they come back in and we laugh and have fun about them trying to figure out when I show them how I washed an elephant without words, the guessing that they do is hilarious. It's just so fun. So it's a fun thing to do. And I've done it, I did it a month ago with at least 4 languages in the room. And they so had much fun with it. It goes across languages and it demonstrates the point. If you're not there, you don't know what's going on and you missed out. And you can't learn, you can't report back and leading to what their children do if they miss. We do another video on for parents about what they can do. And this video is fun because parents talk. They are talking on it about why they get their kids to school, why they think it's important, and that sort of thing. We react to the video. We show some data, simple charts about if your child has low risk about attendance, they're more likely to read proficiently by 3rd grade. If they are high risk in chronic absenteeism, their proficiency in reading by 3rd grade goes down. So then we talk about dropout rates, how chronic absenteeism relates to that. The higher the dropout rate for kids that are chronically absent, and it even goes on to college, so that it affects their college and their college completion. Then we physically demonstrate. 2 parents stand up and we demonstrate how a child falls back each year when they're chronically absent. So we can physically see what happens to a child that is physically chronically absent, as opposed to those that get to school. You can see the gap grow. It's really fun. Okay, and then of course we have breaks in there. Then we get to what does it really take to get a kid to school every day, so that we acknowledge as parents, it's not just get them up, get them there, but it is family practices, the helpers you have set up in case something happens, the car doesn't work. What can schools do? What are they doing to promote attendance? And then community services. So each one of these, we talk about things like routines, avoiding taking vacation during school, practical things for them. Do you have backup plans set up in case the car won't start, or have you talked about that? And for schools, are we asking our schools for attendance? What's the rate? What's my child's rate? What's the school overall? Do we let them know, that we are aware of attendance and we want to track it, we want to know, so make it known to us. And then different community services that can support them and their children in getting to school. I just was reading a testimony the other day about a family member. And this particular family was in a homeless situation, and a child kept being late. And it was, of course, the school was like, all right, let's figure this out. They get with the family. Long story short, the student wanted to go shower, clean up at a community center before he got to school. So he was always late. And of course, the school doesn't know that until we talk with the family, the student, then we figure out, okay, there's a real reason behind this tardiness or whatever. And what can community services do for the family, for the student, etc. So many times, instead of just thinking truancy, we get to, okay, what is really going on here? And it was a story that just made me stop and think. And then we play a final game where I made a stack of cards, and there's 2 parents that are standing up trying to get to school. and they draw a card out of a pile, and one of them will have them step back, like I didn't set my alarm, take 2 steps back. And one of them is the night before we laid out our clothes, etc. And that's 5 steps forward. And so there is a competition to get to school. Okay, so that's just sharing with you some of the fun. And then we do a video. And you can see here that it says absence creates gaps in learning, which may affect a child's self-esteem and confidence. So we start to touch into social emotional learning, which many families, that language is different for them. Social emotional learning, what is that? And so we start talking about that. What is social emotional learning? Or what is social emotional character development? So we talk about, define social is the ability to interact with others, with other children and adults. Emotional is your child's ability to regulate and control those emotions, and how we see all of those emotions in our children. And then a topic that family members really do like to address is character development. And they like to talk about goals for their children to be respectful, honest, have self-discipline, responsibility. So when I'm talking with families, and as we're talking with families about social emotional learning, this term character development or these kind of terms are what families love to talk about and hear. And I'll ask families often, what is one character trait you want your child to develop this year, and they may say, that they're honest, or and many times they'll say, we want our child to be happy. We just want them to be happy. And so we spend some time on character development, and they love to talk about it. You almost can't do it enough with families, because it's their hope and their dream that their child does develop this, the character development. And as we link that with social emotional learning, this is what we focus on. This is, the work that we do in social emotional learning. So then we do a little cheer, and I'll say, give me an S. Social, give me an E. Emotional, give me a CD. Character development. So we're all on the same page. We've learned together. And then a fun video for the parents on social emotional learning. Some of you have seen this, and it's the marshmallow test. And it is the best demonstration of children trying to practice self-control or self-management, whatever you want to call it. And they drop off a marshmallow and say, if you don't eat this marshmallow, I'm coming back in a minute and you get 2. And so the temptation is so strong. And we see children practice self-control, and some give in. And so it's lots of laughter, and we all see our children in this video, but it really brings to life social emotional control and learning that we all have to learn, and we practice. So one of the things that there's a short video on Panorama Ed, I think it's 4 minutes, and it is a researcher that talks about connecting social emotional learning and attendance. And if I'll send these slides out so that you can go and listen to this researcher, but the next couple of slides that I'm going to show you are from their research. So we're going to look at it, but you can listen to them talk about it a little bit. So from the research around attendance and social emotional learning, they did 100,000 students, I think 100,000. And they said what social emotional topics, they pulled them together, are most correlated with attendance. Well, the very first thing is engagement, classroom engagement. If kids are engaged in the classroom, if they have a personal relationship with a teacher, with an administrator, you can see that's the leader in attendance is engagement. And that can come through those. I talked to a Kansas high school that has an adult check-in with a student every week. Every week, they're all assigned. And talk about powerful connections. That is engaging for the student to come. Then in social emotional learning, it was self-management and it was self-efficacy. Remember, these are students saying these are things. These are social skills that are important to us and that get us to school, that make us, and we develop when we're at school. Self-management, self-efficacy, our effort increases, and our emotional regulation. So is SEL linked to attendance? Absolutely, and it's research-based. But from this research, we can see in particular the social emotional skills that are built when kids are in school and how that affects attendance. So for example, I do some did you knows. Did you know highly engaged students are 57% less likely to be chronically absent? We want them engaged. And did you know students who report low social awareness are 2.5 times more likely to have behavior incidents? So we want social awareness that is taught in schools, that is developed in schools, because it makes for fewer behavior incidents. And did you know students who report high self-management are 75% less likely to face failing grades and courses? So again, self-management, that social emotional skill that they learn and develop in schools, prevents those failing grades. And then this is an interesting chart from that data also, is which student groups have the largest achievement gap. Here's students chronically absent. Here's students regularly attending. So it is nearly a double achievement gap. And it makes sense. I've done it. I mean, again, common sense. You got to be at school. And those that are, but the achievement gap is double between those students. Free and reduced population, you can see the gap. The achievement gap is higher, for them also. And then again, it is higher for boys than it is for girls. 8% there. That's the looking at the achievement gap. And then you can see from attendance and social emotional learning, out of 100 students, those who report being disengaged, 23 are chronically absent. But those who report being highly engaged, 11 will be chronically absent. So, and remember that engagement is part of social emotional learning because they're attentive. Like Kent Reed sent out a great article this morning on social emotional learning. Learning to raise your hand in a class is self-management, self-control, being able to get in line to go to an event or a room. So this engagement in the classroom, I hadn't thought of it a lot as social emotional learning, but a lot of it goes in, a lot of social emotional learning goes into engagement in the classroom. And then we talk about what's something you're going to share with other parents as you leave here, et cetera. And then we've got lots of resources for them. So as I said, there's like 3 videos in there that are fun for you to watch. But as our executive committee just talked about attendance and social emotional learning, And I told them I was doing some work in this area, having a good time really doing it and tying it together. They said, Jane, could you share a little bit about the work that you do with families and how it's done? And so you got kind of a glimpse of some of the fun that we have, but the videos you can watch on your own and use any way that you might want to. Because I tell people, of course, you take my slides, you make them your own. You next fall may have bringing attendance home night with your families and have some fun with them and talk about, wow, the impact that attendance has on their children's learning, because families always report out. They learn so much and it meant so much to them. So any questions or comments about what I rapidly kind of shared with you there?
Jane, you got a lot of comments in the chat. Everybody was very appreciative. And, you know, when you're presenting your information, I just have to go back and think about, you know, a lot of times in school, attendance is something we just think, well, they'll be here. You know, we don't pay enough attention to absenteeism, I think, in schools. And one of the things I liked about your presentation is how you define for parents, you know, what is absent, what isn't absent, what's excused, what's unexcused. And even the excused absences are counted in chronic absenteeism, you know, and some, well, that's not right. Well, they're still not in school. And then you weave it into the social emotional. So it's just so important. And then I loved how you tie it into third grade reading. I mean, you know, you think about that piece, and, you know, legislators this year even we're talking about wanting to have a thing for third grade reading. If they didn't reach a certain benchmark, they wouldn't go on. Well, you got to look at chronic absenteeism has a big impact on learning, whether it's third grade reading or whether it's high school graduation. You know, and so maybe we need to think about, how do we go back? How do we put more emphasis on chronic absenteeism? Because if they're not there, they can't be engaged. But once we get them there, then we have to work to get them engaged. So a lot of good information there, and really appreciate your presentation. We've got a few minutes. Anybody has a specific question that they want to ask? Jane, why don't you unmute and do so? There was, like I said, Jane, you need to read the comments. A lot of good comments in the chat for you.
Yeah, I will read them. I can't do two things at once, so I have to do it after.
Yeah.
Jane, will you send the PowerPoint to Kayla so that Kayla can share it with all of us?
I will. I am happy to. And you make it your own. You delete.
And the next time I'm asked to go across the street to the Lions Den, I want you to go with me.
You know what? I've never been asked to do it, Kent. So my knees might be knocking.
I think you need to experience that, Jane.
Okay, I do too.
My point is, and to give them the benefit of the doubt, probably 3 times over the last 6 weeks, legislators have told us that sometimes we talk over their heads, but this is the kind of presentation that they can relate to. And I think it also is a kind of presentation that really sells what we're trying to do with social emotional learning.
Yeah.
Thank you, Jane.
Exactly.
I would be honored, Kent. And you know, schools and districts, I believe, aren't they required now to track attendance?
Oh, yeah.
And chronic absenteeism?
Yeah.
Yeah.
To take my thought one step further, we all know what KSDE is. That's the accreditation system, and it's really the probably the biggest piece of accountability that we have, at least, you know, within the agency and the state board. And they really are focusing on hard data. And so this is an example of where social emotional learning is integrated into that hard data, or embedded in that hard data. And we can begin making decisions as a school district based on that.
That's right. That's right. That's why I was so turning cartwheels over the family engagement and attendance data from our survey. And we had never done that before. And so that was, like we say, we got our common sense, but that doesn't sell legislators or that doesn't write grants. And so we've got to have that data, and it's fun when we do. Helpful.
And it ties a lot of things together, this presentation.
I was just going to actually jump in there because it goes hand in hand with one of the things I'm focusing on right now, which would be suspensions and expulsions, Jane. And I watched a webinar the other day, and it indicated that high school dropouts are 63 times more likely to be incarcerated, which obviously impacts so many other things, including taxpayers' dollars and whatnot. And then they also, the presentation was by Jessica and John Hannigan, and they also had this notion of doing no harm, like the oath the doctors take, and are we as educators kind of taking that same oath ourselves and in our practices. And so I'm really kind of trying to focus a lot on alternative discipline measures and promoting that, which will keep kids in schools. So here up at KSDE, we are actually going to do we're going to try to push a little book study out with some of our staff. The book is called Don't Suspend Me. It's the second edition by Jessica and John Hannigan, and they also work with the TASN team to help train. So I just thought I'd throw that out there and make that connection too.
Excellent.
Excellent. Very good, Shanna.
Other questions? One more question or comment for Jane?
I'd like to ask a question, Jane, as Diane just said. So you're in Garden City. There's a lot of school districts out there, and there's a lot more buildings. Is there a way to train maybe principals that they could use your tools to have these conversations with families, maybe at parent nights or things like that? And conversely, I think Kathy and I talked a couple of years ago about site councils. I don't know if we still have them. I think they're still in the statute, but really kind of an underutilized, always looking for something to do kind of opportunity. So what are your thoughts?
Oh, Diane, I have no greater joy than training leadership, principals, superintendents, because sometimes they just, they don't, like Kathy said, you just don't think about it. You just kind of go, okay, get your kids to school, get them to school. Well, but when you give them meaning and the behind it, then they can take a slide or two and go, this is why it's important, mom and dads, we need you. This is the long-term effects. And so, there's a principal listserv, or, curriculum leader list. Sometime, a training at the I think Tammy and I are going to submit at the KSDE conference. So we're trying to do this at conferences because in my 15 years as director of KPERC, I have never had such focus on attendance and chronic absenteeism. And of course, that does involve the family and should. And we don't want to wait till the truancy stage where it's all, the negative and that sort of thing. Let's approach it as a school community and say, we need you, and look what it does for your children when they're at school. Look how they achieve, and the difference that it makes on the entire school, teachers not having to make up stuff and all that kind of stuff. So Diane, we are at every conference that we can. If there were a principal or soup get together or something, if I'm asked, we're there. If I'm asked, we'll be there. But and I at some point maybe need to try to figure out and do a recorded webinar or something. But those aren't quite as fun. But it's an option.
It's more fun to have Jane in person.
More fun to be in person too. The games matter. They're fun, and after we finished up one of the last games, it was real neat because one of the parents goes, "This is fun," out loud, and they did not speak English. It was interpreted, and so I was with a population that had a high chronic absenteeism rate. And so, it can come out being scary and little bit defensive, or it's all in the approach and how you share it, that sort of thing. But yeah, I'll do everything I can, Diane. If your liaisons, if you feel that's a benefit, or if your groups ever bring principals together, something like that, think about it. Think about it. I'm available.
I think that's a great idea and a great opportunity. As I said earlier, sometimes we just poo-poo focusing on attendance, and I actually think we could get a lot of benefit if we'd focus a little more on attendance and focus on it positively, not negative. And you've got the data here to show what a difference it makes. So Jane, thank you. Thank you very much for your presentation. A lot of good information. And I'm not sure it's been this long since we've had so many drops into the chat box. There's all sorts of this stuff there. So very good. Okay, folks, we're going to break for lunch. We're scheduled to be back at 1 o'clock. So I can imagine you're going to take a lunch break, but you're also going to, I know you're multitaskers, so you're going to be busy for a little bit. So we'll be back at 1 and we'll finish up our meeting. So thank you all. Well, good afternoon, everybody. Kayla, you might check the waiting room and see if there's anybody that needs to be let back in. I know I had to get let back in because I had to charge my laptop up over lunch. Wouldn't make it the rest of the day. So you might check and see if there's anybody waiting to get in. So welcome back. Again, this is the School Mental Health Advisory Council for our meeting. We're finishing up after our lunch break. So hopefully you got to take a little lunch break and weren't doing too much other tasks, but I bet y'all were. Yep, juggling those balls, keeping them in the air, huh, Bert? So, yeah. So hopefully you got a chance to have a bite to eat or so. So welcome back to everybody. And we're going to do our afternoon agenda is pretty brief. But we're first going to start with KSDE updates. And Bert, I believe you're on for that. So if you could start us off.
Be glad to, Kathy. First thing I want to recognize Ken Huey. I think Ken, I heard, is retiring. Is that correct, Ken?
That's correct. Yes.
I want to thank you because I think you started with us 4 years ago.
I did.
You're one of those original members and we will miss you. You've been a great member and we really have appreciated the work you've done here for school counselors, school mental health, very much appreciated. So let's give Ken a little applause. Thank him very much for his years of service. Great job. The second thing is I hit the enter button when I was trying to get to the next line, but I left you, you're probably thinking, who is Catherine White and what's this Kansas FASD support network.org? Catherine reached out and contacted a state board member and said that she would be willing to work with anyone who wanted to connect with her. She is the adoptive parent of a child who evidently has fetal alcohol syndrome. And she would like to network with any agency or organization that's willing to work with her. She thinks that awareness is important. She's alarmed by how frequent fetal alcohol syndrome does not go diagnosed, and therefore there isn't a treatment plan that is implemented. Of course, we also know that we have drug-induced syndrome as well. But she represents fetal alcohol syndrome. So please, if you have any interest, her email is in the chat and it is where it says Catherine White and it's from me. Second thing I want to share with you is the shortage that we seem to be experiencing in mental health providers in public schools. When we did the ESSER program, which was we had 3 levels of ESSER. We had an ESSER 1, we had an ESSER 2, and we had an ESSER 3. And as a result of that, it seems that we turned into, I think I just went off. Can you hear me? Can you hear me now? Good, because
Yes.
my screen
Yeah.
went black. It's been doing that a lot. Guess it's trying to say shut up. But anyway, the ESSER program, a lot of agencies, a lot of public school districts added mental health support workers. So they added social workers, which got mental health very upset because we stole a lot from mental health, we being public schools. We also added counselors. We have an extreme shortage in school psychologists. I know the vacancy report only reports that we had 8 vacancies this year, but we know we have more than that. School districts probably did not do a good job of filling that report out. And then on top of that, we had private school funds that came in the form of EANS. And I'm sure some of you have heard of the EANS program. And I counted how many positions the privates wanted to add, and it was a huge number of counselors and social workers that they wanted to add as well. So what I'm trying to say is mental health is a really big hot topic right now. And it's the service provision that's so critical to our youth that are coming out of the pandemic. And some have been traumatized. And I'm reading a book right now called iGen. And it's the small I generation. And it's by Twenge, Twenge. And she talks about the culture of children that were born after 2000. And some of the issues that they have with personal social. because so many of them have been internet children and they do everything through social media and how important social media is to them. And I know that we've talked a lot about suicide, and we know that that impacts our youth today, these iGen children who just seem to feel like they don't fit in, they don't have any way to fit in, and so they just want to end their life. So I think it's important. I see that Idalia is holding her phone up, but I think the important thing is that if you get the book on iGen, it will, as it did for me, it blows my mind what the youth of today, because they're marrying later, they're dating later, they're driving later, they want their parents with them for longer periods of time. And she has the graphs to show it. So I think it's important that we keep track of what's happening with our youth as well as the generational. They talk about the boomers and the millennials, and then they talk about the iGen population, which have had internet since the time they were born. So a lot of issues out there for mental health right now that we're dealing with, and we're trying to support the field just like all of you are. And that's where this collaborative teaming on the School Mental Health Advisory Council is so critical and important, that we build these partnerships and that we work together for the good of the state, and most importantly, for the good of our families and our children. So I wanted to leave you with that message from KSDE, that we're all in this together and we're all helping each other out, and we don't have silos. We all need to have a flat plane that we work off of. And that's why I'm so excited by the mental health intervention process, and by Carrie writing these grants that are getting funded. No pressure, Carrie, none at all. And by all of you that are in this work, because when we started School Mental Health Advisory Council, I remember that first meeting, we really didn't know why we were there. And so we kind of went through a process of birthing. And from that process, then we had a second year, we came back and we were toddlers and we were working together. And by the third year, we finally figured out, hey, we think this is something that's going to stick. And so that's when this council became formalized and adopted their bylaws in this process. So we're in it for the long haul. So from a KSDE perspective, hang in there, everybody. We're all in it together. We're all here to help the state. We hope the legislators understand that some of their current policy legislative decisions could impact youth in a negative way through unintended consequences of these consents, that we could have some kids fall through the cracks. But I know that school systems are still going to work with those families to try and find solutions when they have a child that truly has an external, internal behavior that is manifesting itself and creating problems for that child. So with that, I'm going to see if Kent has anything he would like to share.
Well, I mentioned the summer academies, and what a great opportunity. We've had summer academies for years since I've been here, the 18 years that I've been here. But this is the first time that we're offering not only a social emotional strand, but also a school counseling strand. So what I'll try to do is send the registration to Kayla, and Kayla can distribute that out. But it is a great opportunity. It's supported through ESSER funds. So the fee is only $50, and it's 2 days of really great intensive professional development. So you might share that with folks that you know that might benefit from attending. And again, they are located at Manhattan, Goddard, and Garden City. And we're also going to have a virtual opportunity, and you'll see that on the registration link.
Thanks, Kent. That's great information, a great opportunity. You're absolutely right. We have these one-time funds that have come in, and using those to try and support some professional development this summer and broad-based it so that it covers a lot of different topics. We'll also have a special education strand that Tazan and Carrie are coordinating and working on. Any other KSDE updates? Carrie, did you have anything else you wanted to share?
I'll share it. So Carrie had mentioned Project Aware. I don't know how many people are familiar with that, but it's a grant opportunity that has come out through SAMHSA, which is the Substance Abuse Mental Health Services Administration. AWARE stands for Advancing Wellness and Resiliency in Education. It's a 3-year opportunity, I think 3 year, or maybe 5. Carrie, do you remember? I don't know. I'll look. But we have had a couple of different entities approach us because one of the requirements for anyone to apply for this grant is that they partner with the SCA. And so we put a lot of consideration into what we could best choose that would maximize the opportunities and the services that would go out to students, specifically targeting for us the gap kids, those kids that just have a lack of access to resources. So we are actually have signed a commitment letter with the University of Kansas. Their telehealth rural outreach for children of Kansas. So it's Kansas Rocks, Children of Kansas Rocks. And then KDADS is another partner, and then we're also working with Greenbush on this. This will increase mental health services through structured and evidence telehealth services that will hopefully lead to increased student instruction and decrease absenteeism. So it goes right in line with what Jane was talking about earlier. There's a piece of school personnel training. We want to build the capacity of school personnel because oftentimes those direct ones on the line are the people getting the questions and needing to support kids, and they don't necessarily always have the capability of doing so. So working with school personnel, post-trauma approach training. There will be a 0.25 FTE allocated to this work through the SCA and KDADS, the partnership with that. And we're just really looking to use existing resource to maximize existing resources and and add in the Project Echo telementoring. I think that's pretty much it. The application goes in on the 1st. It has to be submitted by May 1st. But it looks really, really promising, and we've already done so much work in this area, and the infrastructure is there. So if anyone has questions about that, let me know.
Yeah. But it is pretty highly competitive because they're only awarding 3 grants nationally. So I'm sure there'll be many more applicants than that. So,
Bert, I have a couple of other things real quick. If you don't
Sure,
mind.
Kent.
We have several different partnerships with CASEL, which is a collaborative for the advancement of social emotional learning, and Jane touched upon social emotional learning so well. But one that I want to bring to your attention is that they asked us to provide a case study on how we have taken workforce development and blended it with social emotional learning. And we refer to it as employability. So Stacy Smith and I, Dr. Stacy Smith and I did a video that should be out soon, and also the printed case study involving activities to help schools understand how to really incorporate social emotional into workforce development in that career domain. So that'll be coming out, and I'll send that out when it's ready. And then last night, Dr. Michelle Miller and I did a video for the U.S. Department of Education's ESSER National Conference on the Grow Your Own model for school counseling. And she talked about the shortages that we have. And if there's anybody that wants more information about how to grow your own in terms of school counseling, just let me know and we'll send you that guidance.
Thanks, Kent. Any other KSDE updates? I don't want to miss anybody. Remind you of the conference, and Kayla will be sending you information on that because we've talked about so much we're going to send you. Your heads are probably spinning going, oh my gosh, my inbox is going to be so darn full. What do I go to first? I would say the conference, if you want to attend, would be the first item that you'd want to attend to so that you could look at the dates. You could work out arrangement for a hotel, and we get you registered. And that's what I would do if I were you. I'd take that as priority. So with that, Kathy, unless anybody else has something else they remembered, I'm going to turn it back to you.
Thanks, Bert, and thanks to all the staff for the updates. Those summer academies are really a good opportunity to get in and find some good learning there. So as Kent said, they're in Manhattan, Goddard, and Garden City. So they've got, three pretty wide ranging areas to take a look at. So if you get an opportunity to go to one of those are always real good. And we'll be anxious to hear an update on Project Aware and see how that begins to proceed. Okay, we're going to go on to agency updates. And I know Rochelle Soden, I think you were going to give us an update, and I know you had to jump off here pretty quick. So
Yeah, thanks.
Okay, you bet.
Hey everyone, just a reminder, I'm with Kansas Children's Service League, and on break we were kind of chit-chatting about a training that I know Jose attended yesterday, and I think maybe a couple of others of you did. And so Kathy asked me to do a quick agency update. So April, of course, as many of you know, is Child Abuse Prevention Month. And of course, we're coming to the end of the month, but that doesn't mean the prevention work stops. But for the month of April, we ramp up a lot of our activities, and KCSL, in partnership with one of our other CAC partners, has been providing a training a day for April. So we're all a little bit tired by the end of this month with a lot of training. And yesterday we hosted speakers from the Institute to Transform Child Protection, and they spoke on mandated reporting through a trauma responsive and racial justice lens. And it was free for anyone in Kansas to attend. It was 3 hours in length. And what it really covered was talking about mandated reporting as a professional responsibility, but the need for professionals to regularly examine best practices and incorporate what we already know about trauma and racial disproportionality in child welfare, the importance of our relationships, and thinking how those connections can impact whether or not we make reports, and then all of that tied into our ethical responsibilities for reporting. And so the speakers were really great, and what that was really tying into is the conversation shift that is happening in Kansas, also in other states, as really looking at not just thinking of ourselves for those of us who are mandated reporters, but how do we think of ourselves as mandated supporters? And what does that look like? And how do we actually support families before the issues rise to the level of needing a report? And if it has risen to that level, then how do we continue to support families through the process versus just, I've made a report and now my responsibilities are done. And so it was a really great training. We had, I'm still waiting through the registration and roster because we had a training last night as well. I think we had somewhere around the ballpark of 430 people that fully attended the full 3 hours. And then we had an additional somewhere between 70 and 100 people who attended portions of the training. So we had well over 500 people logged in from around the state, and a very good representation from school districts and CASAs and court services, and of course, Department for Children and Families, and then a lot of the nonprofits and mental health organizations. So it was a really great training. The feedback from it that just came in through private message to me or through email response to me so far has just been really, really positive, in that this is such a needed conversation for thinking through not just ourselves as mandated reporters, but really truly what is our ethical responsibilities for supporting families. And then a lot of that ties into knowing resources. And so that's one of the things. And Jose, I don't know if you want to add anything, since you did attend it and probably paid better attention than I did, since I was managing those 500 people and all the conversation and chats and private messages to collect questions. So I unfortunately didn't get to pay full attention, or if anyone else attended, if you want to come off mute and share, you certainly can. I know Jose was having some good conversation about it earlier, and he may be out. I don't know if he's still on. So. And he might not be back. So the other quick agency update that I wanted to share, because I know Kent Reed knows this information now, because earlier this month he had reached out to Erica Hunter, who is over the Protection Report Center at Department for Children and Families, to find out what training was preferred to be linked for schools to be using going into the fall session for their mandated reporter training. And Erica let the cat out of the bag, which it is public information at this point, so we can start talking about it. But let Kent know that DCF is now partnering with KCSL to do all of the mandated reporter trainings. So all requests from schools, if they want in-person requests or virtual trainings, can come to me. It can come to our training inbox, or it can come directly to me. We are working on aligning information for what DCF is deeming as paramount information out of their training, which pretty much aligns with what our training has continued to be over the years. But we are incorporating, of course, the language to start really getting people to think about that shift from mandated reporting to supporting, moving away from the system of surveillance to a system of support for families, and those kind of languages. And then with that partnership for our agency, we are hiring new staff trainers. And one of them is actually starting next week, and I'm super excited about that to help take the burden off. But that person will be working on trainings that are not just on mandated reporting, but that on advanced or emerging child abuse and neglect topics, such as things like preventing unnecessary reports or distinguishing neglect from poverty or economic housing or some of those things. And then also looking at developing trainings on understanding not only racial bias, but implicit bias as well. So we should have a whole slew of new trainings by the end of this year, many of them related in the realm of abuse and neglect topics. But then we also have another position starting that will be focused on early childhood and family support topics too. So training has exploded for us. And so with that, we're hiring, which is great.
Oh, Rachel, thank you for that update. It sounds like there's a lot of good opportunities and some good future opportunities. So if school districts are interested, they can just shoot you an email, right?
Yeah, they can. I'm actually already getting requests, and we're starting to schedule already for August in services with a lot of places. The great thing, I always say one of the best things out of the pandemic is that when we did have to move everything to virtual, what happened for at least training is it exploded because it allowed people to be able to join trainings, because we provide all of our trainings on a monthly basis. They're at no charge to people to attend, but it allowed us to reach places that we typically wouldn't have joined trainings because of distance or location or just never being scheduled in their areas or their districts. And so we have grown 240% in our training over the last few years, which is just nuts to think about. And the majority of that growth has happened during the pandemic. And so, so even with things going back to in-person, virtual is not going anywhere, where we intend to keep all of our trainings being offered virtually, because we are picking up a lot of people from different districts from across the state that normally wouldn't be able to attend training otherwise.
Okay. All
So
right.
thanks for letting me give the updates.
You bet. Well, thank you for sharing. Lots of things going on. Okay, Leah Hawley, I think you want to share about some things.
Hello.
Yep, there you go.
All right, I got some audio problems. So Families Together is pretty excited. I don't know how many people know about the Just Like You film series. It actually originated out of the Kansas City metro area, and they've done some films on facial anomalies, autism, diabetes, and other different disabilities, starring youth from the metro area who share their stories and strategies. Their newest one that just came out at the beginning of March is actually called Just Like You, Anxiety and Depression. And it stars 10 young people from the Kansas City metro area, as well as Abby Eden from Fox 4 News and the voice of the Kansas City Royals. And talking about anxiety and depression, and really touching on the story of how do we prevent suicide. Because one of the actors that is actually was in the original filming portion of it was a real big advocate for anxiety and making sure people understood his anxiety. Sadly, he was one of those metro area youth who took his own life. So his family talks about that story.
Oh, we lost you, Leah.
Okay, sorry about that. Families Together is actually going to be hosting a free screening of the film on March 25th at the KU Edwards campus in Overland Park. And
March 25th?
No, I'm sorry, May 25th.
Okay.
May 25th, coming up. And
that makes more sense.
Yeah, I put the link for the trailer in the chat. All of their videos up to this point, or their films up to this point, have been free. This one they are now charging a fee for. You can buy it if you want, $8 or $15, whatever. But we wanted to get it out there for families and have a screening. And we're going to follow the screening by a panel of the young people who are in the video, as well as some professionals who can share some resources and what supports are available for families and youth. And I will make sure that once we get the registration link, I mean, literally, we are just on the cusp of this. We finally got our location and everything down. But as soon as I get that registration link, I will share it to Kayla and she can send it out to everyone here. And if you could help us get it out to families, that would be excellent. And I mean, professionals can attend too.
Okay, thank you, Leah. That sounds like a great opportunity. Tracy, you had something you wanted to share.
Yes, the last time we met, I was telling you guys that we were doing a request for proposals. And for the leadership edit, which is an equity-driven, informed by trauma summit. We have solidified all of our speakers and registration is open. It is June 17th. It will be on Crowdcast. We have opening keynote Jim Sporleader, which is the principal from the documentary Paper Tigers, sort of the godfather of trauma-informed education. So Jim will be with us. Dr. Letitia Woodley from Kansas City Public Schools will be our closing keynote. And then we have 16 breakout sessions from speakers from across the nations, leaders in school districts doing the work, everything from alternatives to restraint and seclusion, from Guy Stevens and the Alliance Against Seclusion and Restraint, to partner districts in other states who have really been on the trauma-informed, equity-driven journey to build sustainable systems level change. Speaking about that, we have principles of alternative programs, speaking about alternative realities, what it's like in an alternative program in a district that's not trauma-informed, but their building is. And so I wanted to share the invite with you guys to please attend, please share with your agencies, communities. We also have community partners speaking about how to build successful, sustainable community partnerships between agencies and school districts. And so I wanted to share that with you guys. It is 100% free and open to everyone. Our goal is to create an interconnected network of people who are invested in creating equity-driven, trauma-responsive school systems. So the invite is open to you guys to please attend and share amongst your networks. We're so excited to be hosting this, and we're excited to do it again, hopefully in upcoming years in person as well. I also wanted to just say that we were talking about the shortage of counselors, social workers, and school psychs. KCKPS has many openings for all of those positions. So if you guys know anybody interested, send them to KCKPS and the Human Resources website, because we are also looking for all of those positions as well and have multiple openings at all levels for counselors, psychs, and social workers.
Tracy, are you okay with Kent and I sharing out the leadership information, the training on our listservs?
Yeah, that'd be awesome. I can send you guys the graphics as well so that you guys have the graphics.
Thank you.
Great opportunity to get that information out. Sounds really good and helpful to a lot of folks. Delia, you put something in the chat. Would you like to talk about that?
Sure. Along with many of the great offerings that folks have put together for this summer, I've been working on a project with 321 Insight. That's a company based out of Oregon. And this partnership is being provided to our to Kansas educators in part by a large grant that I recently received. And this is going to be launching a 3-year program that we'll be developing. And the kickoff will be on June 21st at our KNEA building. And it'll be free for educators to attend, titled Addressing Better Strategies for Addressing Challenging Behaviors. And it's also targeted for ESPs who also are facing many of the same challenges as our classroom educators. And when we refer to an ESP, we mean that could be the cafeteria worker, the secretary at the front office, your custodians, really all of the employees that work with students, and quite honestly, probably know much more about the students than classroom educators ever do. They're from the communities, they see them outside of the classroom, which when students are more authentic. So this is a great opportunity, and some of the work we'll be doing is really focusing on supporting our education support professionals. And I'll be putting out more information on that.
Well, thanks, Adelia. That again sounds like another great opportunity for folks. Appreciate you sharing that with the group. Are there any others, agencies that would like to share something?
Well, this is Kathy K.O., and I'll just put in a quick plug for the book, What Happened to You by Dr. Bruce Perry and Oprah Winfrey. We did have Dr. Bruce Perry present to our staff through our Evers grant out here on President's Day. And then as part of that, we had everybody that was working in special ed did many kind of root analysis and action plans on how they would begin to implement some things. And we've seen it really helped people understand trauma. And since then, we've done some book studies. And I mean, it really did set off a lot of people in working in the right direction in better understanding trauma and how it affects the students and the families we work with. So just thought I'd share that. But it's a really good book and easy to read.
Thank you, Kathy. A little summer reading activity for everybody. Anybody, anything else to share? Diane, I think you're still on. You've been following the legislature. You got an update for us?
Well, I should know better than try to predict their timing. So just when I thought they were going to wait until mid-May to take up the vetoes, the House took up the vetoes during our meeting today. The governor's vetoes on the Parents' Bill of Rights and the trans students in girls' sports both were sustained, so they're both remain vetoed. The vote on Parent Bill of Rights was 72 to 58, and the trans sports was 81 to 41. It takes 84 to override the governor's veto. So the veto stands. I've also been watching and refreshing often to see if I can find the report for the school finance bill to see what the language is in there about the surveys that everyone's wondering about. It has not been submitted yet. The Senate goes back in at 2, so I'll be watching that, and they can't receive the report unless they're in session. So I'll continue to watch that, and I will get the information to the group as soon as we have it. Thank you.
Thank you, Diane. Appreciate you following that. And I guess we don't all have to listen. You can follow it for us. Didn't mean to say that to you in the middle of a drink, but had to chuckle. Okay, all right. So I think that any more agency updates? Anybody? Okay, seeing none, I would ask if there's any future agenda item requests that anybody has. I think we got quite a bit of information earlier today that we might be able to put into a future agenda item. Is there anything that you feel like the group, it would be beneficial for the group to look at? I'll throw that open.
Shanna, could you revisit the July
Yes. So
information you described earlier?
Yeah, so kind of some ideas that we have down for July and at least in October, and possibly even moving on beyond of that. July we'll be doing the networking with each other, and then working on kind of revisiting again that mission statement, purpose statement, and our annual focus areas that we want to really highlight this year with our next year of work. And then in October, when we meet, I'm thinking one of the ideas we had was to kind of get a panel together, somebody representing the BSRB and social work licensure. Same thing for school counselors, same thing for school psychs, and same thing for family liaisons, kind of having a panel of those folks so that they can really describe their work, the scope of their work, and how it overlaps, and then how it's different as well. Then I have notes that we would like to work with the MHIT project to create video superintendent success stories, and work with the SMHI and the School Mental Health Advisory Council with experience with the PRTF process. I also want to throw out there, Gary's not on this call today. He had another training today, Gary Hinault, but I would like to have him on that same meeting so he can go over the PRTF guidance document that's been in the works for the past year. So yeah, lots of topics.
I think we also talked about the possibility of having DCF report on their foster care report card.
Yes, I have that down. I just missed it. Thank you.
Okay, no problem. And then within that, Shannon, were you thinking about it when we look about those different positions? Were we talking also about how do folks kind of build a team and kind of figure out how to overcome barriers and that kind of stuff? Are you thinking about blending that in there too?
Yep, for July.
Great, okay. Other ideas from the group? A little bit of wait time here.
Well, Kathy, if anything comes up, Shannon and I and Kayla kind of take on the KSDE leadership role. You can contact any of us. You can contact Kathy Bush, let Kathy or Jane, who's our vice chair, let them know if you have any topics, and we'll see what we can do to get them incorporated. If not in July, then somewhere along the line. Because we had so much come up now with all these trainings that are going on, we might have some report outs that people want to provide.
Absolutely. Well, and I think this will be a good opportunity for, as we do that work in July, as Shannon mentioned, when we kind of look at revisiting our mission and our kind of purpose statement, those kinds of things. And we may have some ideas of some other things, and particularly with some of our agency groups, some other things that we kind of want to partner with and figure out, how do we work together on these more thoroughly. So I think we'll have a lot of direction as we move forward. So anything else for the good of the order for today? Well, seeing none, those of you who are in the schools, I wish you a good last few weeks. I would guess some people are down to almost 3 weeks, and some people maybe a little more than that. Graduation's coming up, always an exciting time. So I wish you well in the last few weeks of school. And I know a lot of folks are going to gear up this summer for some extended learning time and get kids in to work on the reading and the math and how we kind of make up for some of our pandemic lost time. I know some districts are still talking about, they just had kids this year that just kind of disappeared. They didn't come back. And they really didn't know where they were. So kind of interesting to think all about that. Kayla has put next year's schedule in the chat. So you might want to, as far as when the meetings are, you might want to take a look at that. I'll read them off to you real quick. October 13th, December 8th, February 23rd, and April 27th. So you might want to go ahead and get those in your calendar, and we'll kind of stick with the 9 to 2 time frame. And we will plan on doing these in person. The July one will be in Wichita. Otherwise, we'll be up in Topeka, and Kayla will provide information as far as, because I know some of you, if it's Topeka, some of you are going to have to come in the night before, that you have a good distance to drive. I can make it from Wichita, but so she can provide information when we get closer to that point. So again, our next meeting is on July 26th That's a Tuesday, and we typically start at 9. Are we doing this one in July? I know it's a half day. I'm kind of looking at Bert and Carrie. I'm thinking,
Kayla, did we say 9 or 8:30?
I believe this one is at 8:30 in Wichita.
Yeah, because
okay,
we're only going to have a half day, so we wanted to stretch that extra 30 minutes because we're going to need it.
okay, so make a note that the July 26th one is 8:30, and that will be in Wichita with more information to come. Melanie, included in the living in Western Kansas, yes, and working in the schools in person during the school year is going to be very difficult. You know, we have in the past, when we did the in-person, we also had a Zoom feature set up. It's a little more difficult when we're in, some of us are in person. It's not more difficult for you to watch. It's a little more difficult for people who are on Zoom to interact, but it can be done. So Melanie, we will have that opportunity for folks to tune in remotely. So that possibility will be there also for those folks who just can't get away. We don't want to not have you participate.
Thank
So
you. I
anything
appreciate that
else?
greatly.
Say again?
I said thank you. I appreciate that greatly.
Oh, you're very welcome. Anything else? Okay, well, thanks for everybody who presented today. Lots of good discussion about a real variety of topics and more fun to come in the near future. So have a great rest of the day. And as I mentioned earlier, those of you in the schools, have a great rest of the school year. Thank you.
Thank you.